Namaskar, Swagatam, welcome. We would like to welcome you on our journey, an infinite journey of brainstorming, an infinite journey of knowledge sharing by senior generations to younger generation, and by showing the world that really Vasudhaiva Kutumbakam is defined here on Ayush Samriddhi platform. I am really grateful to all the speakers as well as our resource person, friend, philosopher and guide, Dr. Suhas Kumar Shetty ji, Dr. V.K. Agnihotri ji, Jagdishwar ji, Jayesh Thakkar ji. So without you, this holy journey could not be possible to continue. Welcome Dr. Rupali Varua ji from Assam. As we are passing today World Autism Awareness Day, and the right topic for autism, definitely it may be autism best supportive care. I don't know. I'm really unaware of that whether autism can be cured or especially by Ayurveda or Ayush. So without wasting much time, I would like to welcome our senior expert on the topic, Vaidya M. Prasad ji, founder Sunetri Ayurveda Ashram, Trichur. Welcome, sir. Welcome.
Thank you very much. Namaste to all the dignitaries here. Can I begin? Please, can I share the slides?
Yes, definitely.
Okay. Thank you very much. Let me begin. Chadurmukha samarambham vakbhadacharya madhyamam asmadacharya paryandam vande guru paramparam. I hope my slides are visible. Okay. So I'll be talking today about the topic of or the subject of classical Ayurvedic therapies in Ayurveda on this occasion of the World Autism Awareness Day 2022. First of all, let me extend my thanks to the organizers, especially Pavanji, for giving me this opportunity once again. Last year, I had this wonderful opportunity to participate in this beautiful session. And once again, I am invited and I am honored. Thank you, Pavanji, for that. Yes, I'll be talking about only the essential things. There may be some slides which are not relevant, which I will skip immediately. So today is April 2nd, World Autism Awareness Day. It is observed annually on all April 2nd by the member states of the UN to raise awareness among its citizens about people with autism spectrum disorder throughout the world. And this year, the theme of World Autism Awareness Day is inclusive quality education for all, which of course is closely linked with the focus of our last year's World Autism Awareness Day observance, that means inclusion in the workplace. The pandemic, COVID-19, in the last couple of years have changed the social scenario a lot. Many people suffer. Many quarters of social life got collapsed. And one particular group, one particular section of the society, which got affected maybe to the most, but got attended to the least, That group is the group of autistic kids. And the so-called online education. Of course, we all are the beneficiaries of this shift to the online, which has made practically the physical distance negligible. But unfortunately, that was not the situation in the case of autistic kids. They were doing their offline class, the normal classes, with a lot of engagements in the social circumstances, in the social life, which were all cut altogether, all of a sudden, because of the pandemic lockdowns. So that is the background in which this inclusive quality education for all is selected as the topic of discussion or the theme for this year's World Autism Awareness Day. But having said all these things, I'll be talking about an entirely different subject. This is the question: is autism a disease? The word autism spectrum disorder, I'm keeping away. Is autism a disease? The classical or the official answer is no. The NHS website tells us autism is not an illness. Being autistic does not mean you have an illness or disease. So that is a categorical statement. Again, CDC website tells us autism spectrum disorder is a developmental disability caused by differences in the brain. Some people with ASD have a non-difference, such as a genetic condition. Other causes are not yet known. Scientists believe there are multiple causes of ASD that can act together to change the most common ways people develop. We still have much to learn about these causes and how they impact people with ASD. So this question is answered in a categorical way that it is not a disease, not an illness. But I think, or I would like to believe that there is a lot of trick in it. Why treat if not a disease? That is the question. If it is not a disease, why should we treat it? But interestingly, the situation is that as of now, the Western medicine does not have any specific remedial pharmacological intervention. But meantime, extensive research studies are going on to identify the causes specifically, the pathological mechanism behind, and possible remedial interventions for autism. And many therapies are used to treat autistic kids as of now. Many of them are included in the approved list of interventions. Many of them are not. Anyway, people are running after therapies to get their children treated. All the children with the disorder experience difficulty in developing social, speech, and behavioral skills. Therefore, behavioral therapy is usually the first line management in most of the situations, along with pharmacological therapies added to help patients function in their daily activities. So pharmacological agents are permitted to treat not autism as a single clinical entity, but people with autism, to treat autism-related issues. Risperidone, a second-generation antipsychotic drug, was the first drug approved by the FDA to treat autism-related irritability. What I mean is, there are pharmacological interventions slowly creeping into the scenario of autism management. Maybe it may be labeled as this is not the treatment for autism, but it is related to the management of autism related issues, irritability, hyperactivity, or something like that, sleeplessness. But anyway, very intensive and very extensive efforts are going on. And as of now, as none of these things are proven completely and their safety and other measures are not proven, still there is a widespread narrative that autism is not a disease and need not be treated. What if a medicine is developed tomorrow? That is one question. What if a medicine is developed tomorrow? So the entire scene will change. So whether these sort of acceptance or whether it is a sort of recognition as a disease or not a disease, all these things are relative to the existing circumstances. Now, coming to the Ayurvedic impression on autism, autism is a vyadhi which needs its pratikriya. Autism is a vyadhi which needs pratikriya. It is a vikriti which is to be brought back to prakriti. It is a dukkha which takes sukha away. It has nija and agandu types of possibilities. It has possibilities of ama visha, ojakshaya, unmada, graha and apasmara elements in its origin and development and its course forward. It has stages of sadhyata and asadhyata, and accordingly the strategy of chikitsa shall vary. And from my experience, I can say with full conviction that classical Ayurveda chikitsa is beneficial in this vyadhi. Ayurveda chikitsa is beneficial in this vyadhi. Now, I should say something about the line of approach, I think. Like any other vyadhi, here also, the line of approach is spinning around these three factors. That means ahara.
Your slides are not moving, sir.
You don't see this line of approach?
No, first slide, only first slide is visible.
Oh, here it is moving. What I would say, I would do is I would reshare. Just 1 minute. I do not know what is happening. Just 1 minute. I will start reshare. Sorry. It happens something like this always. Is it visible now?
Yes.
Okay. So
clear.
This was the slide which I was explaining earlier. That means autism is a vyadhi which needs pratikriya. It is a vikriti which is to be brought back to prakriti. It is a dukkha which takes sukha away. It has nija and agandu types of possibilities. It has possibilities of ama visha, ojakshaya, unmada, graha and apasmara elements in its origin and development and progress. It has stages of sadhyata and asadhyata. Accordingly, the strategy of chikitsa shall vary, and classical Ayurveda chikitsa is beneficial in this vyadhi. That is what I was mentioning in my earlier slide. Now, the line of approach revolves around three factors like any other vyadhi: vihara, ahara, and aushadha. Aushadhanna viharanam ubayogam sukhavaham. That is upashayam. Upashayam is the synonym of chikitsa. Now, regarding the vihara, what should be the strategy? I'm not going to give any specific answers that can be applied as one for all remedy. But certain core ideas can be maintained. Regarding the vihara, it should be as natural as possible. The vihara, the environmental factors, that is what we mean. It should be as natural as possible. as spontaneous as possible. Of course, they are closely related words, but I'm using the word spontaneous to specify the avoidance of artificial, unwanted, forceful interventions into the developing environment of the child. And the vihara should be as unstructured as possible. When kids are sent to maybe some play schools or some elementary schools, it is interesting to note that where there is minimum restrictions, minimum conditioning, and maximum unstructured environment, the children evolve the best to the best. Where there is maximum compulsions, maximum restrictions, and maximum structured environment, they suffer. And vihara should be as soothing as possible and as positive as possible. These were the last two were the most suffered areas during the pandemic period, as far as these kids were concerned. They suffered a lot. That is why I mentioned that. See how the autistic kids had setbacks in the lockdown period. Those who are attending these kids may be knowing this very well. Of course, there were some lucky parents who got the advantage to spend more time with their kids during the COVID, and those children definitely benefited from it. But that was not the case with most of them. They suffered. There were many setbacks. That is why even this that Awareness Day theme itself was fixed, as I mentioned earlier. Regarding ahara, make it as traditional as possible. The recipes, the way of cooking, the type of eating, the ingredients, everything, make it as traditional as possible. I'm not going to say that you go back to the maybe some 10th century AD or something like that. As traditional as possible. Similarly, as local or as regional as possible. Use the stuffs. Similarly, make it a point that the food is homemade. All the junks are avoided. Chemicals, additives, artificial tastemakers, artificial colors, avoided, all these things. So that is the concept in the management of ahara. Then some core ideas which are to be kept in mind. Living body is a system of systems. Don't separate them to watertight compartments. It has interconnected and interregulated systems of operation. And the best concept which shows this idea is the concept of tridoshas. So they should not be addressed separately or independently. There is a close link always in between the system, body. Take the body as a whole, take the body and mind as a whole. There are some connections which we will be mentioning, of course, as a passing reference of this. The changes inside the body in autism, like accumulation of heavy metals, toxins, various types of deficiencies, hypersensitivity to certain types of foods, these are all evident with these kids. And many attempts are done to throw them away, the toxins, the heavy metals. But in my conviction, these are all effects of a faulty mechanism in place, not the cause of the problem. And when you are trying to correct, correction is needed for the basic errors and not for the effects. So don't focus on these superlative, also not superlative, it is the superficial presentations. Go one step down and find the causes where the basic correction is required. That is the one which is to be addressed. Now coming to the Aushadha, Agni shall be considered as the kingpin of all bodily operations, physical as well as mental, instinctive as well as nurtured. All the cognitive functions, Agni has to be considered as the kingpin. Yadannam deha dhatojo bala varnadi poshanam or karanam tatra agnir hedur ahara nahyapakvad rasadayah. So the purity of the dhadus, the shuddhi of the srotas, clarity of the ojas, and dhi, dhriti, smriti, all these things are depending upon Agni. It influences ojas and manas. I always used to speak about Om triangle. That means the Agni, ojas, manas. Amapajanam at kosta level and dhadu level, the medicine should be selected accordingly. Deepanam is essential. Aushadhas which are beneficial in Vishahara, Jwarahara planes, Ojaskara, Rasayana, Medhya planes. There are many medicines, very simple things like Kalasagadi Kashayam, Amrudottaram Kashayam, Vilwadi Guliga, Panchakolam, simple drugs like Haridra, Vaja, Rudraksham, Kalyanaka Khridam, Panchagavya Khridam, Tiktagam, Saraswada preparations, Brahmi Siddharthagam Khridam, all these are examples. Suvarnam, that is gold, is one golden thing that can be used in the management of ASD. These are the classical Ayurvedic therapies which we use and which we have experienced as beneficial. Of course, this is a menu card. That doesn't mean that all these things are to be ordered for every kid. Abhyanga, oil massage, Shirodhara with various types, sometimes Thailam, sometimes Takram, sometimes Kashayam. Talapoditsil, that means head wrap with herbal paste. Vasti is having huge potential. Various types of vastis. We are experimenting and researching with the different types of vastis. We have done n number of vastis that way. With ghee, oil, decoctions, Kashaya Vasti. And one interesting thing is that Dadhi Vasti has got huge potential. We are working on it. Then Navarakiri, that means this Shashtiga, Pindasvedam. Different types of Nasya with the Thailam, Arishtam, Swarasam, etc. Aschyodanam, all the Indriyas should be used positively for bringing in the sort of sensory integration. Aschyodanam, Aghrananam, inhalations. We use many medicines for Aghrananam and also Dhupanam, fumigations in the room where the child lives. So these are all classical Ayurvedic therapies which can work wonders if done with some sort of a proper selection, logic, and justifiable experience. So my take-home message is autism is treatable. Autism is a disorder. It is a vyadhi. It is treatable, and it is possible when these three circles come together. That means early diagnosis, supportive tools, committed parents. If these three things come together, we Ayurveda people, we Vaidyas can treat ASD. That is my simple and humble message on this World Autism Awareness Day, April 2, 2022. Thank you, Pavanji, once again for this wonderful evening and wonderful opportunity. Thank you very much.
Excellent, Sahib. Excellent. As usual, always excellent. Great, great. You are always inspiring and informative for us. Definitely, we have learned everything from you.
Thank you very much.
Agnihotri ji.
Thank you, Pawan Sharma ji. Namaskar. Great thanks to our first guest speaker, Dr. Prasad sir. Very definitely, what concept he put forward with relation to the autism is very practical. Practical in sense, it is not necessarily necessary that each and every term given for any disease or every disease by the modern medicine or by allopathy is available in our Ayurvedic text. What we have to do, that person is here who has got some congenital problem with the physical and mental development, and parents are having, as a kid, everything given by God. Even they cannot think that it is a curse over me, it's a responsibility or whatever. So they make all efforts for management, and they also console their mind by their own, instead of any psychologist or psychiatrist or any doctor, though doctors and society help. So what we Ayurvedic persons can do, they can only think in the lines of the Samprapti Ghatak, and on the base of the symptomatology, and along with, since we know that it is ahar which develops everything, which also develops the nervous system. So as you told that Koshta Shuddhi, number one, along with some Deepni Aushadhi, along with Vasti, along with the Nasya, if it is done in a proper and under great say supervision, we do hope, as you told, that the miracles can happen. So your approach is really practical, and what we learned from you, that we should not lose heart, we should not give up, we should manage ourselves, that it's a challenge, and we should come forward, because medicines are always there. As you told that they say that since this is not a medicine, if it is not medicine, that why they are treating, they are just making a fool or giving some depressant, some stimulants or some say this thing. So instead of that one, without concealing any concept, Ayurvedic person which you touched, really it's a great work and worthy work. In these lines, you send a very good message to the society. There's those parents who are having any of the member of their family with such type of ailment, they can consult a good experienced Ayurvedic physician and can go for a betterment. Thank you so much. Thank you.
Thank you, Agnihotri. Thank you very much.
थैंक यू अग्निहोत्री जी, थैंक यू प्रसाद जी, बहुत बहुत धन्यवाद आपका, बहुत बहुत धन्यवाद सुशांत जी, आपको भी अटेंड करने के लिए। हमारे साथ प्रिंसिपल वैद्य पारुल जोशी जी भी जुड़ी हुई हैं, उनको भी नमस्कार। सभी को बहुत बहुत प्रणाम। डॉक्टर दिनेश दास जी भी हैं, रेणु जी भी हमारे साथ जुड़ चुकी हैं। मैं अब अपने नेक्स्ट वक्ता डॉक्टर कार्तिकेयन जी का स्वागत करता हूं। डॉक्टर कार्तिकेयन सर। यस, वेलकम सर, वेलकम। Dr. Karthikeyan is founder of DOAST Dost Clinic, specially for these diseases, and he has his different opinion and different therapy treatment system. Welcome, sir. Welcome.
Welcome.
You are all inspiring us. Welcome, sir.
Should I present myself now? Okay.
Yes,
yeah.
sir, you can. Yes,
Yes,
sir.
yes.
Yes. Pawanji mentioned that I have a different concept. It is not a different concept. See, like possibly I am the odd man out in this team. I'm a ENT surgeon coming from the mainstream medicine, but I have a love for the traditional Indian systems, and I practice integrated therapy. I just want to, combine the best of the traditional Indian systems and fuse it with the scientific revelations from the mainstream medicine. So in which I look at autism as an inflammatory disorder. the inflammation more in the vascular intima, the blood vessels of the individual. And as the previous speaker told that it is a disease, yes, it is not a syndrome anymore. It has got a pathophysiology and it has got a treatment window, and it can be called as a disease, so that it brings in peace into many families by making these children better. So we work with a concept that these children should be made independent at least by the age of 18. So when we say these children should be made independent, they should be ethically semi-independent, able to do certain light tasks, and if we are successful, we can also make them an earning member of the society or the family. See, that is our mission. And in our path, we are at least about 2 decades old now, and we have about 6 children who have crossed the age of 15 to 18, and 2 of them are earning members. And that is what I can say as a message of confidence to this whole team who is listening now. And as the previous speaker mentioned, that it is treatable, and we have to send the message to the families that autism is not a hardwired condition, and the brain can be rewired. And the rewiring pattern could be different, and we need to identify a treatment window. And the treatment window that we identified is, as I told you, the molecular denominator is inflammation in different functional areas of the brain. So if the inflammation in different functional areas of the brain are addressed, and when the vascular endothelium inflammation comes down, there is release of hypoxia in the chambers or in the functional areas of the brain. So when the hypoxia is taken off, functional connectivity comes, and when the functional connectivity comes, the symptoms slowly disappear, and the person starts to act in a way that we all act, like we get our inputs processed, stored, retrieved, and then we make it into a good output. The same way, the children can also receive their input and then convert them into a proper output by connecting all the functional areas if the inflammation is taken off. Different systems use different methodologies, and the ideal way adopted by the Indian traditional systems of medicine, let it be yoga, Ayurveda, or Siddha, or anything else, is detoxification, rejuvenation, and then regeneration. This principle is specifically applicable to the treatment of autism. And different specialities or specialists from different walks of medicine can have their own techniques, can have their own medicines, but we need to work on possibly a common platform where we address the autism in a way that it is not a neurodevelopmental disorder, it is a neuroinflammatory disorder. So when we approach autism as a neuroinflammatory disorder, and the inflammation happens in an individual who is not having a robust molecular mechanism to tackle the stress in the environment, let it be the toxins in the air, let it be the toxins in the food, or metals, or whatever which are talked about. And if this stresses in the environment spoil the molecular mechanisms in the individual, affecting the homeostasis. This will affect the brain and cause problems in the connectivity of the functional areas of the brain. So, in my experience, I found the techniques and medicines from the traditional Indian systems of medicine, like yoga, siddha, are very useful, along with a dietary correction and preventing these children from exposure to electronic gadgets. So this is in a nutshell how we approach the problem of autism as a hardware software incompatibility. So when we correct the hardware, which is the brain, it receives all the software and becomes like what we are. And that is possible. In our experience, we are trying to increase the numbers to show the world that this can be done. And if Pawanji can play the video, if it is possible, which I sent it to you, that would be a good 4-minute visual.
On which email ID, sir?
Gmail ID?
On
Gmail?
Kindly tell me email ID, sir.
Yeah. Just a minute, please. Dr. Sharma at imamigroup.com. Can I send it to you through WhatsApp? Is it possible to link it up? Yeah. It's in your account, sir. WhatsApp. This video shows the new center that we have created near Tirunelveli town in Tamil Nadu, near Kanyakumari, where we have used all the natural elements and play elements. These are children in residential system. They are with the parent.
No idea. Right, okay.
It's a common kitchen and parent together dwelling units, and in a clean air without the petroleum fumes. And we are taking them back to the nature.
Stretch your right leg. Stretch your with your left leg. Hold your left.
This is the evidence of input through the ears coming out as an output in the somatosensory system. The yoga session lasts about more than 1 hour. Asanas, breathing exercises, and then relaxation is done together. You could see how they relax completely. This is tapping on the serotonin in a very, very non-invasive, non-chemical way. And regulation of serotonin is the key to opening the doors of autistic behavior. So we are taking them from the bubble to independence, mainly through the traditional Indian systems of medicine. But we understand the whole process by the research findings of the mainstream medicine. And we use it to create the integrated therapy. Thank you so much.
Very nice, sir. Very nice and inspiring. Very nice.
Thank you.
You have created milestones in your area, sir.
Thank you. Thank you so much. Thank you. Thank you.
Now, next generations have to follow those footsteps, what you have created. I would like to welcome Madan Thangvelu, sir, from UK, and Dr. Harish Verma, sir, from Toronto. Welcome, welcome, sir.
Pawan ji, namaskar. Agnihotri ji, namaskar.
Namaskar.
Dr. M. Prasad ji is with us. Dr.
Karthikeyan ji, namaskaram. Vanakkam, sir.
प्रणाम सर, प्रणाम सभी आचार्यों को प्रणाम.
Your video was very, very inspiring, and we are thankful that you have come to the platform today to share your development since you were here with us last year, since that in that one period, 1 year. So thank you again.
Thank you.
I hope you will stay with us for the rest of the program, because there are a few other wonderful presentations to follow.
Yeah, I will. Yeah.
And I liked your comment about the serotonin mechanisms and how you can trigger. We don't have with us today Dr. Avdesh Pandey. Avdesh ji is also looking at certain aspects of not autism, but he's looking at activating the pineal gland, and he's got some development, some modifications he has done on the Shirodhara procedure. And I wonder if you have used any of this on your children, any Shirodhara variations, which would be a which would, I think, it might have some role in, for some, I don't say for all the children, but for some of them, they might respond in interesting.
Yeah, we definitely sandwich Shirodhara with other voliation techniques, and then we have kind of standardized our own, lateral approach techniques to these children, because like we apply it even to children at the age of 3, because like these children are very, very delicate systems where Shirodhara can be sometimes dangerous with depression of the respiratory or the cardiac rate. And then we need to be pretty much careful in handling these children. And then again, these children are prone to pneumonitis if you are not very careful post-therapy and bath and all these things. So all these things are taken care. And then as you have mentioned, the Shirodhara is fantastically useful in controlling the hyperactive children, and Takradhara and Tailadhara, they have different outputs, and that's what we have observed. And in some children, we choose Tailadhara, and some children we use the Takradhara. And unfortunately, like you being a basic scientist, we still do not have a biological marker to kind of evaluate these things to show to the Western world that these are possible. We just still have to depend on the behavioral parameters, and that is why they just knock us out. And we are definitely making huge inroads into the gene patterns, and then their protein output mechanisms, and then all these systems. Even yoga, when you see those children lying down, I stimulated them deep. Even then they don't wake up, but with an auditory stimulus they immediately wake up. So these are all mechanisms we have not still understood, and we have not the kind of parasympathetic elevation that we are able to do with all these Dhara procedures, and then with the Yoga Nidra. And these are all things which have to be, documented to the Western world to show that it is not only autism. There are so many things. See, like post-COVID, we are having a lot of neurological problems, and then those things can also be helped with these kind of techniques. And it is not the kind of competition between these systems. These systems have to walk hand in hand together, understand each other, and otherwise the people are at loss. And then we load them with a lot of technical jargons, saying like this and that, and then they don't understand, and then they don't want technical jargons. They just want results, And when the child speaks, or when the child is able to do the AD, or when the child is able to control the bowels, and all these are, if you are a parent, you will know how much it affects their peace. And then this coexisting community we have created with 4 people living together, and this is bound to grow. And then we want to create an exclusive community of people with autism, so that we have only data coming in the past 8 weeks. We see these children, moving with each other. Their peer, their interaction is phenomenal, that we have not seen in Chennai, and when they live together. And the parents' stress level has gone down dramatically with coexistent living. So these are all things that we have not tried, and then this has to be done, and this has to be done. It is not a one-man's job, and we have to combine together. And then, I think I should mention that without a thin veil of ego separating all of us, we should work together, and then, put our findings through, so that the larger, the reason why I created this community is like, I wanted people to come and see, feel and touch what is happening. And rather than my publication going to Lancet or Nature, I want them to see physiologically how it is transforming into a real life scenario, so that the fantastic science that we are living, given by our forefathers, can be useful to the humanity.
Kasi, and we are very lucky, very fortunate that you are a patron for our activities here. And we are very fortunate that you have brought today to the platform further work that you've done in the last year. And additionally, we are fortunate that you are also representing the Siddha community. I don't know, we would like our audience to recognize that you are very deeply connected with the Siddha community in Tamil Nadu. So please do stay with us. I think Pavanji might want to take us to the next speaker, and then as we come into the discussion sections, there'll be many more questions. And I think Harish Ji from Canada will resonate with your comment about using different types of dharas and prakriti types and all these things. So we'll leave it for the discussion moment, and there'll be several other comments that will come. So Pavanji will take us on the program. Thank you. Namaskar Ji. Thank you
Thanks,
again.
Dr. Karthikeyan sir. Thanks, Dr. Madan sir. Excellent. Always inspiring. Dr. Renu Rathi ji. I would like to invite Dr. Renu Rathi, Professor and Head of the Department of Komar Bhratya, Mahatma Gandhi Ayurved College, Hospital and Research Center, Wardha. Dr. Renu Rathi ji, welcome.
Thank you everyone. Good evening to all. Today's topic is autism. We all know that today we are celebrating or awareing the people to society, particularly on this 2nd April. So today's learning objective are definition of autism, etiological factors to know about diagnostic measures, then explain concept of autism and management, particularly in Ayurveda, emphasis on multidisciplinary and holistic approach, need of parents and family education to tackle autistic child, focus on lifelong care and follow-up. So autism particularly is a neurodevelopmental behavioral disorder, and it should be diagnosed before 3 years, because as early as we diagnose it, we can able to start the intervention, start the management, and it will help a lot to the autistic child. So to start with the definition of autism, it is classified under pervasive developmental disorders. This is a cluster of symptoms that share marked abnormality in the development particularly, and these 5 varieties are ASD, that is the autistic spectrum disorder. We can conclude it in a one umbrella term, and the other terms are Rett syndrome. This is particularly occurs in only girls, and this is related to genetic link up, and in this Rett syndrome particularly there is a regress of developed milestones. That is the peculiarity of Rett syndrome. In Asperger syndrome, there is a language and cognitive level is not much derailed, but a little bit autistic symptoms are there. Please excuse me, charger. I'm bringing the charger. Just a minute. Yeah, thank you. Later on, childhood disintegrative disorder and pervasive developmental disorder, in which the similar autistic features are there, and these all are included in a one umbrella term, autistic spectrum disorders. So you can see here in this picture that this train is derailed and the compartments are shuffled, and in the same way, autistic children may suffer with different developmental derailment, and in that way we have to bring them in the sync, because with the help of so many interventions, and so it requires a team, because to make the things proper or with the sync, it is very important to take help of so many other interventions too. So prevalence, talking about prevalence, it is generally link up with genetic factors also. So in family studies, it is demonstrated that 50 to 200 times there is an increase in the rate of autism, and currently it is 54 per 100 per 1000. The specific modes of inheritance are not yet clear. There is a not clear-cut cause of autism. There is a chromosomal link up of 7 to 4 and 15 and 19, and may be associated with the Fragile X syndrome, particularly 1% and up to 2% may have tuberous sclerosis. Just we know that unclear theories are there. So there may be abnormalities in neural connectivity, dendritic and synaptic morphology, understanding and execution independently, means the understanding and its execution, they are not in a sync. And genetic causes mainly Fragile X syndrome, tuberous sclerosis, and Angelman syndrome and metabolic disease are maybe associated with autism. So we need to rule out it. For most of the children, no etiology as such found, but molecular genetic studies have identified abnormalities in dopamine gene and thyroid receptor beta gene in some patients. There is a screening, particularly these chat, the name chat, Q chat, the different screening tests are available. Then may also Indian Scale for Assessment of Autism, that is ISSA, Indian Scale for Assessment on Autism, and Childhood Autism Rating Scale, that is CARS, and then DSM-5, then Intl tool for autism, then Trivandrum scale for autism. These are some scales for the particular assessment of ASD. Related to investigation, we can also do electroencephalogram, that is EEG, metabolic profile, genetic profile, DNA analysis, CT, MRI, and so on, because it may related with certain toxins, as previous speakers also focus on the same, that it may associated with the toxin ingestion. That's why we may see that it may be there is a lead or mercury screening is must. Related to Samprapti Kataks and its Vigatanam, doshas are not only Sharir but Manas doshas are also included. That is 3 doshas were pick up all the 3 doshas as well as Manas, that is Raja and Tama. Because many autistic children are hyperactive in nature, and they may be sometimes they may like schizophrenia or like Manas Vikar. They are very much alone and separated, and like we will see in the clinical features also. And related to Dushya, Rasa, Rakta, Mams, these are the 3 main, because Rasa and Rakta we can't separate it out, and all these 3 Dushyas are there. Srotas, Rasava, Annava, and Manova. Particularly Annava Srotas and Manova Srotas are very much important. Rog Marga is Madhyam. Vyaktastan, Sharir and Manas both. Rupa is Vibram of Manas, Buddhi, Cheshta, Smriti, Bhakti, Shil, and maybe sometimes there is an association of Apasmat. Here in this picture, we can see that there are so many variety of typical features, that inability to relate to others, inappropriate playing with toys or solitary play, or lack of awareness of danger, and and strange attachment of objects, and the same repetitive behaviors, and no real fear of danger or insensitivity or echoes words or phrase, or difficulty in interacting with others, spins objects or say, particularly they are engaged with similar kind of repetitive movements or activities. Then, a clinical manifestation is mainly inattentions and early distractibility. Many times hyperactivity is associated, and they often do careless mistakes in schoolwork, and fails to finish schoolwork, or not. They don't listen to elders, or likely they don't want to do what elders or what others say them. Hyperactive or impulsive behavior and motor restlessness is there, and difficulty in planning and organizing tasks is another core area where they are lacking, and emotional liability is also there. Here we can mainly conclude the clinical features in the three ways, that mainly speech delay is there. Also, there is a little or restricted use of verbal and non-verbal mode. Behavioral issues, hyperactivity may be many times associated, and sensory involvement, hypo or hypersensitivity is there. Means they are very much sensitive to touch, or visible or visibility, or very much especially sounds. All sensory involvement is there, whether they are hypo or hypersensitive to the things. Then repeated, pervasive, stereotyped activities or interest are linking up in, and they like to play solitary, means alone. They don't want to mix with other peers, or their friends, or parents even, and other family members too. So related to assessment, we have to check their behavioral changes. Then counseling is required to how to handle such autistic babies, particularly to parents. Then CBT, that is cognitive behavioral therapy, is we can take help of this therapy. And ABA. ABA is again, it is a parental teaching mode, that parents are required to teach how to tackle them. Then ISA scoring, CARS and DSM-5, these are the assessment scales where we have to check that whether our modalities, our treatment tools are going to work or not, or how we can change them to make the quality of life better. So accordingly, we have to check whether in which category they are lying, whether mild, moderate, or severe. And accordingly, we have to change in our modalities, treatment modalities. So ABA is particularly is a therapeutic intervention approach which is based on the learning and behavior. So it is a training part, and it's a program of a particular teaching program. Related to principles of treatment, mainly Agni Chikitsa is very much helpful. Then Saugya Prabodhan, Sadhna Prabodhan is very much important, because there is a sensory sensory sensitivity, and that's why there is a much reluctantness, or very much manas factors are associated. That's why we need to give Medya Rasayan, like all Medya Aushadhis are there in Ayurveda, because the formulations are so superb that they act as a, if we continuous give them, then it acts as a good intervention, that we can see the pre and post results, that so much difference is there. And then maintain gut flora is I think more important, because there is a they are very choosy, and they are very moody in nature. That's why it is, if we facilitate the gut flora, then it can the nutrients can be absorbed in a better way, because they don't eat as we eat in general, that is the whole meal. They don't many times they don't take in such a complete plate. So we have to maintain, in the dietary modifications are required to to facilitate the absorption of nutrients. Then adravya chikitsa is very, very important here. That is non-pharmacological measures, and in which Sattva Vaja is very important, because Sattva Vaja is a such big umbrella term that contains so many minor tools, that is counseling, then play therapy, or Achar Rasayan, or like Sadrutta, or so many other terms are there, which is going to affect the child in a better way. They can handle the things betterly, or they just listen to us due to Sattva Vaja Chikitsa. It's a kind of counseling and meditation also it includes in this Sattva Vaja term. Then we need to take the practice of skill orientations, because in this disease there is a skill is very much lacking. So related to academic or related to so many other skills enhancement, we have to make the things repeatedly as a abhyas, or bombarding of things to make the things grasped. So we have to help them to learn the things. Then we need to, or especially we have to counsel to parents that you must be, or parents must be patient in nature, motivator, positive, and they must be counselor or affectionate enough, and they must be very careful, and all they can take help from social skill group or relationship development interventions or domain method. There are so many groups are there, or autistic societies there, so they can take help of so many even NGOs or even skill groups are there. So we come to the management of autism. Multidisciplinary team approach is very much important here, and especially Ayurveda pediatrician, or modern science pediatrician, then child psychiatrist or yoga expert, occupational therapist, speech therapist, psychologist, then specialist teacher who able to teach such children in a better way, or as a specially abled specialist teacher is mandatory here, and parents and family education is required to handle such babies. Bal Panchakarma procedures and needful therapies are the other measures we can treat such babies, particularly Shirodhara or Tailadhara or Takradhara, or even cold water, whosoever very aggressive and very hyperactive in nature. We can pour the lukewarm water on the head, and or we can change the content of the dhara with tail, takra, or dugdha, or even gomutra sometimes. But to decide the dravya of Shirodhara, what to use, it requires the dosha, which dosha is dominant and which dosha is vitiated, and accordingly we need to choose the dhara dravya. Then also Shiropichu or Talapodichil or Shirolepan, Shiroabhyanga. There are, because the Shira is the main sthan which is affected, and that's why we need to focus on the sthanic chikitsa. So Shiropichu, Talapodichil, Shirolepan or Shiroabhyanga are the other measures we can take, we can concentrate on it. And Nasya, which is directly Nasai Shirsodaram. So Pradhaman Nasya with Jatamasi or Kachuradi Churna or medicated tail, Kruta, we can give as per the dosh vitiation. Then Sarvanga Snehan Swedan, because such children are so much engaged with their solitary play, so they must be very tiresome, but they don't convey the things. They don't able to convey their sufferings. That's why here Vata is always predominantly vitiated. That's why we need to tools and measures are important here. That's why Sarvang Snehan Swedan plays a great role. Then Matra Basti, which is a main Vata Shamak tool, and Mrudurechan or Vatanuluman, whenever we not able to give Basti, then Mrudu Virechan or Vatanuluman is the also important. Then exercise, yogasanas, pranayam, meditation. These are also some tools, thereby we can take help, because yoga is particularly related to sharir as well as mana. So we can take better help better help of this yoga. Then Omkar. Omkar is a continuous chanting of Omkar, is also focusing or changing the waves of brain, that is delta, beta, theta. These waves are there is already many studies are occurred on this Omkar, and it makes a great difference. Then Marma therapy. We will see that Marma therapy is mainly to stimulate the particular point to stimulate their function. Then hydrotherapy. Whosoever are lacking in physical activity or motor function, we can stimulate such babies with the help of hydrotherapy. Hydrotherapy in the sense aqua exercises or swimming. By that way, their motor function get stimulated, and they can improve their motor function. Then music therapy. If such babies are very violent sometimes, or very aggressive or impulsive, then calm and quiet music is very helpful to calm the such aggressive babies. Then Reiki, or so many other tools like occupational therapy, play therapy, or nutritional or diet therapy, because gluten is we will see on diet therapy also. Then AHA, ABA, applied behavioral therapy, and understand their needs, particularly what they want to do, behind the reason behind the tantrum, and reason behind the their so much inner frustration. We need to understand what is their demand, what is their need, and also their sensory sensitivity. Then individualized, actually Ayurveda is a individualized treatment, and it may vary from child to child. So we need to think it is not a similar, it's a single one line that this is similar to everyone. It is not likely, but we need to check which therapy, which measures, which tool is going to help to that child. So we have to choose the particular therapy or tool with the help of assessment and severity, on the basis of severity, as well as on the basis of precision. The main motto is to diagnose early and start management early. This fundamental principle is very much helpful. Then acceptance by parents. I have seen in my practice that so many parents, particularly 4 to 5 parents, have give up the their babies, that this child is not going to is not going to become a normal child, and that's why they start with make ignoring, or they engage with other babies, and they ignore the things. But even after counseling and so many repetitive understanding also, they don't listen, and they ignore the babies. So it is the main thing is that we need to accept that repeated interventions, repeated focus, repeated motivation only will change the scenario. So there is environmental factors has play very great role. So we need to focus on that also, and motivation is very much required. Highly structured or skill oriented and specialized programs for both mother and parents and child, and ways to minimize symptoms and maximize abilities to augment the quality of life. So many therapies we have already discussed. We have to check how better we can minimize the symptoms, and how better we can maximize the abilities. And counseling, Satvavaje, Sadvrutta, Charasan, then Satvik, Ahar, Vichar, and Vihar. Ahar, Vihar, and Vichar. Then avoid triggers. The points where children get angered or very much aggressive, we have to avoid such triggers. And environmental provoking factors. Instead, positivity, assurance, and acceptance is very much required. Here, particularly some drugs are there: Respiron, or fluoxetine, or anxiolytics, or antidepressant, or antipsychotics, but there is a limited role in such drugs for a long time, because they have particularly so many side effects, and in a long run they are not good to continue. So some mega vitamin therapy is okay, but certain psychotic and antidepressive or anxiolytic drugs for a long term is very I don't think they should be given for a long term. Diet therapy in particularly gluten and casein free diet have some role in some children, but it is not ultimately proven that in each and every child so gluten and casein free diet should be restricted, or the casein and gluten free diet should be supplied. No accumulated evidence as such proven, and that's why the only focus is that we have to maintain the gut brain axis, or to help the gut flora better to absorb the nutrients. Then sources of omega-3 fatty acids, like all kinds of nuts, then especially complex carbs are very much useful, that is ragi, then jowar, bajra. These especially having complex carbohydrate contents, and that's why they can help the child to develop in a better way. Also, we all know that brain is developed with the amino acid, that is protein only. That's why the contents, the dietary factors having amino acids, we must be supplied which are rich in amino acids, or protein diet is recommended. Shaman, certain particularly we have already seen that Agni Chikitsa plays very great role. So Deepan Pachan is very much important, and so certain formulations are helpful, that is Rajanadivati, Shivakshar Pachan Churna, or Ampachakvati. Then Snehapan, or for Snehapan, whenever Deepan Pachan is fulfilled, then we have to go to the move to the Snehapan with the help of certain Medha drugs like Kalyana Grut, Brahmi Grut, Panchagavya Grut, Samvardhan Grut, likely. And Vatanuloman is achieved with the help of Avipattika Churna, Gandharvaritki Churna, Trivritta Leha. Then nootropic effect must be maintained with the help of so many herbs are in having Medha properties like Yashtimadu, Gilo, or Shankapushpi, Brahmi, Manduparni. And we can give even Surna Passion or Surna Kalpa, which are very much important. Also, they are rich in antioxidants and immunomodulators, and especially Lagu Malini Vasanta or Vasanta Kalpa, Swarna Malini Vasanta, Surna Passion, Shishubharan Ras, Kumar Kalyan Ras, or Bhratva Chintamani. As per the dominance of doshas, we need to select the doshas and formulations. Also, we have to improve their fine motor skill training. Here, this is my one patient. After treatment, he is able to draw the diagram drawing also, and make the coloring also very easily. And he able to sit at one place and listen to elders, and also going school regularly, and not harming others. Otherwise, he has habit of running here and there, and not sitting at any place, or he is very much impulsive as well as hyperactive. But now after the treatment, he has improved a lot. In the nutshell, particularly multidisciplinary approach is very, very important, and these are the 4 tools, 4 interventions are important, in which first is medication. So multidisciplinary, shaman, shodhan, and all related medications we have to give. Then behavioral and educational both can go hand to hand, that is CBT, cognitive behavioral therapy, or ABA, AHA, Satvavajay, Sadrutta, Acharasayan, or occupational therapy, play therapy. There are so many tools we can improve their behavior as well as we can improve their academic skills also. Also, we have to take care of psychological things with the help of Satvavajay, counseling, and love, security, and lifelong care and follow-up. autism in Ayurveda is just not mentioned, but we can correlate it with Unmad. Because in Unmad, there is a direct description by Charak, Kashyap and Bhagvat also, that Punarmano Buddhi Sabdhyana, Smruti Bhakti Shila Cheshta, Vibramam Vidyat, and Vaichittam Arthriglani Nirunmadam Chopak Kleshayeta. So we have to think that the autism shows impairment of almost all of the mental faculties, particularly Manas, Buddhi, Saujnadhan, and Bhakti, Shil, Cheshta, and Achar. So we have to focus one by one, and we have to change their behavior and their etiquettes or their manners or activities or development, and all slowly we have to focus one by one and take to the consideration and confidence of the parents also, and we need to counsel the parents and assure them enough. So Shodhan therapy means we have already discussed that Mrudu Virechan and Matravasti are alternately, or if the Vat and Pitta, because many times Vat Pitta are major association of those visheshan. That's why we have to add in our treatment modality, our treatment strategy. So Snehan, with the help of Snehapan and Abhinga, also these are the very important tool to help the doshas to eliminate from the near places. Then Chikitsa elevated Tridosh, particularly Vat and Kapha, having effectively many times Vat Kapha or Vat Pitta, both are associated. And Nasya Shirodhara Basti should be employed considering the nature of the disease. Then use of Meddarasan and Snehadrabhyas, especially in the form of Ghrita, must be used in Unmada. Also, we can take help of Sattva Vajay, that is Achar Rasayan, Surya Namaskar, Dhyan, Dharana, and Omkar. Also, we have to learn, teach them certain etiquettes, that worshipping of God or holding of truth or non-violence, avoiding anger. And this list is so much big that we have to one by one, we have to make the environment, because child learns from the environment only. So we have to change our environment accordingly, and thereby they can see the things and they can change their behavior. So this is the pick of Surya Namaskar, because the yoga is particularly related with Sharir and Manas both. That's why yoga is very much plays a beautiful role. So Dhyan and Dharana, because or Omkar chanting is very much helpful. We have seen that so many factors are related to adravya chikitsa or non-pharmacological tools particularly, and these plays with along with dravya chikitsa, that is yukti vyapasara chikitsa. So both of these we have all together in amalgamation. We can start both the yukti vyapasara as well as adravya chikitsa together. Then it makes wonder. Also marma therapy, that particularly we have to press the point below chin, that is center point of this below chin, then in between two eyebrows near bregma, that is this is the bregma point, parallel to the both ear here, then midpoint of occiput and base of the skull, and the latter throughout the spinal cord apart from 1 inch distance downwards till lumbosacral joint. Thereby, because all nerves are going from the coming out from the spinal cords, that's why we have to just a little bit from 30 to 40 seconds we have to press with a little steady but light pressure. And whosoever practice means I used to suggest, but I cannot find out the result of marma therapy only, because I used to practice so many interventions together, so I'm unable to find out the only result of marma therapy. But many physicians do this marma therapy in Maharashtra and so many states. So they think particularly that it regulates Panchabhuta, Panchmahabhut, and regulates brain temperature, regulates gyri and sulci of the brain, and regulates blood components too. Now the take-home message and conclusion is autism is a neurodevelopmental disorder and impaired social communication and stereotype behavior is the main key features, and it is hypothesized to result from cerebral dysfunction arising from a communication interaction and between genetic, epigenetic and environmental factors. Diagnosis is established using ICD-10 or DSM-5 criteria. Multidisciplinary interventions are needed, and particularly non-pharmacological Adravya Chikitsa and Yukti Apasra and Satvavaja Chikitsa are useful. There is no as such complete cure, but however, timely and appropriate interventions can change the quality of life, can augment the quality of life significantly. So it is already previous speakers have think that already told that we have to take so many efforts together, parents as well as physician, thereby and with the help of so many interventions, we can change the scenario, we can improve, we can cure such babies, but it requires great patience as well as a teamwork. Thank you all. So here we can, such autistic baby may change into a good or normal activities doing boy. So we because in boys particularly there is a gender ratio 4:1. Boys are so much prevalent to girls. So we can change the things with the help of these tools. Thank you all. I have already 2 videos, but with the permission of Sharma sir, I can play later on. Thank you all.
Kindly play, kindly play.
Okay, okay. Thank you, thank you. Just a minute. Because it's a great message by that parent.
Please play the video. Video is not coming.
It is not playing. It is already playing.
No. Your last slide is visible.
Renuji,
Just a
you
minute,
might, I think you haven't selected the correct screen for, you might have to stop share and start again because it seems to be fixed on your PowerPoint.
Yeah.
Please start. Okay.
Is it audible now?
No, the image is here, but we can't.
While sharing, please click on 2 boxes down the screen.
Okay.
Please share it again.
Yeah. Stop share?
Please stop sharing. Now start sharing. Share. Just see the down of the screen, 2 boxes are there. Optimize for video.
And share sound.
Share sound.
On the left hand, you have.
कि इसमें अच्छे तरीके से
Is it audible now?
कि इसमें से उसका भी आ गया है ड्राइंग में अच्छे तरीके से वो उसका प्रोग्रेस अब बहुत अच्छे तरीके से करता है और नॉर्मल बच्चे के तरह है वो थोड़ा थोड़ा अच्छे से रह रहा है, खा रहा है, पी रहा है, सब
I'll
खुद
play first one and then later second.
नमस्कार, मैं सपना पेडवाल हूँ। मैं एक ऑटिज्म बच्चे की मम्मी हूँ। मेरा बच्चा ऑटिज्म है। तो ऑटिज्म यानी वो उसके बिहेवियर से कि वो सो नहीं पाता था रात में और चिल्ला रहा था बहुत। रात में उठ के जंप्स करना, चीज़ें फेंकना और तोड़-फोड़ करना। मेरे बच्चे 6 साल के उसको मारना, ये सब चीज़ें वो करता था। तो हमें लगा कि ये ऐसा क्यों कर रहा है, इसका बिहेवियर ऐसा क्यों है। कोई बोलते थे कि वो मेरे खुद के प्यार से ज़्यादा वो बिगड़ रहा है। वो उसको हमें लगता था कि सुना ही नहीं आता है, इसलिए वो वैसा कर रहा है। तो हमें उसका ऑटिज्म का प्रमाण नहीं पता था। तो फिर उसके पापा बोल रहे थे कि वो तेरे ये प्यार से वो बिगड़ रहा है। तो हम फिर गया है तो मैं उसको लेके फिर आयुर्वेदिक में गई, जो वर्धा में है आयुर्वेदिक दवाखाना दत्ता मेघे का, वहाँ पे हम राठी मैम से मिले। तो राठी मैम ने बताया, उसका बिहेवियर सब राठी मैम को हमने बताया कि वो सो क्यों नहीं पाता है, वो रात में क्यों उठता है, वो क्यों ऐसा ने बताया कि वो नॉर्मल बच्चा नहीं है, नॉर्मल बच्चे के जैसा बिहेवियर नहीं कर सकता है क्योंकि वो एक ऑटिज्म बच्चा करता है। तो मैम ने बताया कि उस पे पंचकर्मा चिकित्सा है, आयुर्वेदिक की दवाइयाँ है, वो आप पूरे उसका वाला इलाज कीजिए। तो हमने उस हिसाब से हमने उसका पूरा ट्रीटमेंट अभी भी कर भी रहे हैं और आगे भी कर रहा था। फिर ये उसका बहुत रिस्पांस मिल रहा है उससे कि वो पंचकर्मा चिकित्सा, उसमें बस्ती होती है, शिरोधारा होती है और नसें होता है, पूरी आंख की मालिश होती है, ये सब और भी है। वो ऐसे करके पंचकर्मा चिकित्सा है। और दवाइयाँ, जो दवाई मानस मित्र होती है, अश्वगंधा पाउडर और ये ब्राह्मणी घृत, ये सब 1 2 3 4 के इसमें अच्छे तरीके से ये जिला की इसमें से उसका नंबर भी आ गया है ड्राइंग में। अच्छे तरीके से वो उसका प्रोग्रेस अब बहुत अच्छे तरीके से करता है और नॉर्मल बच्चे के तरह है, वो थोड़ा थोड़ा अच्छे से रह रहा है, खा रहा है, पी रहा है, सब खुद के सब प्रोसीजर खुद कर रहा है और अच्छे तरीके से वो बहन के साथ में खेलता है, स्कूल जाता है, स्कूल में से आता है। अच्छे उसका जहाँ पे उसका सब सामान रखना चाहिए वो खुद वहीं पे रखता है, खाना खुद लेता है, खाता है, पानी खुद लेता है, पीता है। ये सब प्रोसीजर अब वो खुद करने लगा है। तो बस मैं तो ये बोलूँगी, एक ऐसे किसी के भी बच्चे हो, उन्होंने हार नहीं मानना चाहिए। और जो कोई भी डॉक्टर लोग बोलते हैं आयुर्वेदिक का तो सबसे अच्छा रिजल्ट है, तो उन्होंने करना चाहिए, ना कि घबरा के वो बच्चों को डांट के दबट के कुछ हासिल नहीं होने वाला है। उसका चेकअप कीजिए, उसको अच्छा उसको सपोर्ट दीजिए, ना कि उसके तरफ से आप ये मत कीजिए, निराश मत होइए, उसको अच्छा पढ़ाइए करिए और डॉक्टर की सलाह लीजिए। जमे तो तब तक तो आप रिस्पांस मिल सके उसमें। ये ऑटिज्म में तो मेरे को तो बहुत तो ऐसा लगता है कि उसमें अच्छी सुधारना है और वो अच्छे तरीके से बन सकता है। अभी भी मेरा उसके ये शुरू ही है दवाई वगैरह, उसमें बहुत काफ़ी ये हुआ है, फ़ायदा हुआ है। तो आप लोग भी कीजिए, बस मेरा यही बोलना है। तो राठी मैम का मैं बहुत बहुत धन्यवाद करना चाहती हूँ।
Renuji, namaskar. Very,
Namaskar.
very impressive. Renuji, one question from my side.
Yeah.
Do you have a network of these organizations, whether in the academic sector or in the other areas across Maharashtra for autism? Is there some network already in place?
No, sir. As such, no a big network. Only now I have started doing awareness and radio, TV, radio program. Also, I have give my little bit talk on to how to. That the main focus is to that autism is repairable. It is going to change. Ayurveda going to change the quality of life. So this message is going to aware. Just now, I have my PhD scholar has registered, and he has chosen the autism case. So now I have started doing the work. But I wish to join to such network. I am also searching, but this Corona period, I contacted to Amravati and Nagpur also, but I couldn't see the big response from them. But my try is going on.
Well, we look forward to having you as our central point of contact for Maharashtra, because we already have from Kerala, Prasadji is here with us. From Tamil Nadu, we have Karthiji. And from Karnataka, we have Shettyji in Belgavi, who is doing a lot of work, and also SDM Hassan. So Maharashtra, we can make something. And as we come out into Rajasthan, Gujarat, we might have something more there. But we look forward to, I think we'll take up some of these questions, discussion points. I leave it to Pavanji to take us onward to the next speaker. We have a set of questions also from Harish Vermaji. He has put 3 questions in the chat box. We will come back to those questions in the discussions. So I leave it to Pavanji to take us on to it in the program.
Now I would like to request Dr. Lakshmi, Associate Professor, Department of Kamar Bhratya, Government Ayurvedic College, Thiruvananthapuram. Dr. Lakshmi, welcome. Welcome, Dr. Lakshmi.
Okay. Thank you, sir. Namaste and a very good evening to all. Hope I am audible.
We can hear you clearly, Lakshmi. Thank you. Namaskaram.
Okay, namaste, sir. So shall I start sharing?
Please, please. I don't know if you could hear, I don't know if my microphone was on. I had mentioned that Harish Vermaji has put 3 questions in the chat box. We will come back to those points in the discussion. So please do review those questions.
Shall I do it, sir, or?
No, Lakshmi, don't do it yet, because we will bring it, because they're general questions for everybody. So we will come to the end. After the presentations, we'll raise them.
Yeah.
Thank you.
Okay.
Thank you for being with us. I know you have some interest in the microbiome also, so we look forward to hearing some of that.
Okay, sir.
Thank you.
So a very good evening to all and namaste. So thank you, IRES organizers, for inviting me for such a lecture. And also, I thank Pavan Kumar Sharma sir, particularly for inviting me for this session. So today, the World Autism Day. So my presentation will be an integrative management of autism. So as already Renu madam has discussed, that there should be a multi-professional involvement in the management. So that details everything she has covered. So we are not going into the details. So coming to the causes of autism, as you all know, because autism is the relevance of autism is very important nowadays, because I have been into this field of developmental disorders, Ayurvedic management of development disorders at Government Ayurvedic College Trivandrum from around 2005. So from that time, the change that we are observing is that initially the number of children with developmental delays, that means particularly motor developmental delays were more. But now, coming to the last 5 years, what we are showing in our, what we are seeing in our OPD and IPD is that the number of children with behavioral disorders is gradually increasing. Earlier, among the 50 patients that is in the IPD of our department, almost 40 were with motor developmental delays like cerebral palsy and all, and only 10 will be of ADHD or autism. But now the scenario has changed considerably. And among the 50 patients admitted in our IPD, almost 25 will be of behavioral disorders, and particularly autism and ADHD. So the number of autism children is very much increasing even in our small state of Kerala. Okay, so the relevance of this autism day is increasing day by day. So as you all know that there is a multiple causes are involved in autism. So many are saying that abnormalities in brain structure or function is one of the cause, and heredity is another cause, and certain conditions like Fragile X syndrome or tuberous sclerosis is another cause. So an environmental factor cause. So a lot of causes are being explained for Ayurveda. For autism. So all these features, all these nidana had already been explained in Ayurveda. Like in the patients that are coming to our IPD, when we have taken their nidana, we have seen that it is sahaja. That means it is a genetic factor, or it is a garbhaja factor. That means the problems or the ahara vihara of the pregnant lady, and also maybe due to the jataja factor. That means due to that post-meningitic sequelae or like that, or maybe due to that birth trauma, some anomalies happened in very minute anatomical variations in their brain, or due to some problems during their, or hypoxia during delivery, that is the akala pravahanam, or sometimes the unknown cause, and that we can connect it to that prabhavaja nidana. Okay, so these are the nidanas that we come we face or we see while taking the history of autism children in our department. Okay, so among all these, definitely there is tulya gotra vivaha. That means the consanguinity and the different ages of the mother. Then that means even the coitus or the coitus that lead to the formation of the baby, and that all are being explained, and the garbhovaghadagara bhavas that is explained. So all these factors we are actually hearing from the parents while we are asking them the history about the causes of autism. So definitely when we discuss about all this, the systems involved, already Prasad sir has told about the importance of Agni and Manas and the Ojas. So definitely these systems like that is GIT, the gastrointestinal system, and the central nervous system, and the immune system. So there the Ojas and everything comes there, the Bella of the child, everything comes in that, and the metabolic system. So all these systems together are affected in a case of child with autism. So definitely that the gene, the environment, the interaction, that is very important in the case of an autistic child. So all these nidanas are being explained very well in the nidana that we have already discussed, that is the sahaja and the aganduja. Okay, that is the environmental factors. So these we should consider. That means already everyone has discussed about the causes and the types of autism and their management, but we have to look into the prevention also, but because the number is increasing day by day. Okay, so as you all have seen that sir told, Madan Thangavelu sir told, there is an involvement of this microbiome, that is the gut microbiome, the oral microbiome, and even vaginal dysbiosis, everything. So all these factors will definitely have an influence on the GIT, and that actually changes the gut microbiome. Okay, so these factors actually through the Ayurvedic management of that proper Agni Divana or the management by doing different types of Vasti, we are actually making the gut microbiome normal, or to normalize the gut microbiome of that autism child. Okay, so thereby the gut-brain axis, the functioning of the gut-brain axis becomes normal, and the neurotransmitter production almost becomes normal. So that is what we are postulating. That is the postulate that we are put forwarding. Okay, so so the Nidana, as we have already told, Bija, Atma, Karma, Ashaya, Kala Dosham. So Madhurahara Vihara Dosham. So that we are actually Madhurahara Vihara Dosham during the pregnancy period is very important. That actually we are giving more, we have to give more importance, because nowadays the Ahara Vihara of the pregnant ladies, particularly Vihara, because they are actually Bharta Bhrutteshcha Garbhadrak, because most of them are stressed in working women. They are almost stressed, and even the support from the family and their relatives is not proper nowadays. So that should be taken care of. Otherwise, I think the whole world will be full of children who are not responding to each other. We have in the initial presentation, Prasad sir already was discussing about whether autism is a disease or not. But definitely, when you are calling your child beta, or you are calling by the name, and your child is not at all looking at you and not at all responding, then definitely it is a Vigridi and it is a Roga. So we have to consider, or we have to reduce the causes of autism. Okay. Then see all these the Nidanas, we can come to the Samprati, that is, it may be the Bija, Atma Karma, or Kala Dosha, or it may be due to any problems intrauterine, or it may be the Madhurahara Vihara. And the main dhatu that is affecting will be definitely Rasa dhatu. So there comes the importance of Agni, because only with a good Agni, a good Rasa dhatu is formed. And with that Rasa dhatu, only a proper functioning of the mind and the proper the Sattviga Vigaras, or the Sattviga Bhavas will develop in a child. So the Agni and the Rasa dhatu is the most important factor that we have to consider while discussing about autism. Okay, then so coming to the management. So the modern management takes into the behavior and communication approaches, because no appropriate medications are there. Risperidone, etc. have been discussed already. But behavior analysis, as Madam had already told, ABA, and cognitive behavior therapy, everything is there, occupational therapy. So these all therapies actually we cannot avoid, because even though you are doing or Ayurvedic management or any other management, definitely you have to do the Dhidhairya Atmadi Vijnanam Manodosha Ushadam Bharam. So that is the Sattva-Vajaya Chikitsa is very important. So what we are doing in our center is actually we are doing Ayurveda plus all the therapies. That means the behavior therapy, the speech therapy, and other occupational therapies, etc. are being clubbed together, and we are doing it in a package in our Government Ayurveda College, Trivandrum. And definitely the dietary approaches is also important. That is actually the key factor in Ayurveda, because the pathya is very important. That depends on person to person, because it is individualized. Definitely autism is individualized. We cannot generally create a dietary pattern. We can say the pathya ahara is important. Okay. Then the complementary and alternative therapies, Madam already told about other Reiki, Marma therapy. Marma, we are also doing that Varma therapy from Tamil Nadu. Shanmugam sir has come to our department, and he has taught us about that Varma therapy. So we are doing that head massage and all that Madam already discussed. So our pattern, what we are doing is also the same. That is, the first initial step is a correction of the Agni, that is by Divana. And then after that, we are actually doing that Shodhana. So before Shodhana, mainly we are doing Snehabana. So that is Bahya Abhyantara Snehabana. Along with internal administration of medicated ghee, we also go into what Abhyanga like treatment. That depends on the condition. If it is a Kaphaja condition, we usually go for some Tikshna Taila like Karpuradi or Shadahwadi. And if it is more Vadiga, then we will go into Kshirabala or Thanandaran Taila like that. Then the most important Shodhana that we do is Vasti. So Vasti is very, very important, and actually that Vasti helps to normalize that gut microbiome. So Vasti and the Divana is very important, and Udvartana also we do because some children with autism spectrum disorder has hypersensitivity. They don't like to be touched, and they don't want to touch wet substances. They don't want to take food with their hand. So likewise, their hypersensitivity is there. So that to reduce the Udvartana has shown us very good results in reducing the hypersensitivity. And also we are doing Shiro Piju, Shiro Dhara, etc. type of management also. So Takradhara also we are doing. This is the pouring of medicated liquid. Sometimes we do in Shiro Dhara. Takradhara is a Shiro Dhara, or sometimes we do it as a whole body Dhara. Okay. Then Shiro Leba also we do. Medicated paste is applied on the head of the child. So Shiro Leba, different Shiro Lebas are there, like with Musta Takram, or along with the milk, Bela Sohalam, like different combinations are there depending upon the dosha avastha of the child. Okay. So actually this is a package. This is actually a case we published a case series of autism spectrum disorder in International Journal of Ayurveda, IJAPR, in 2017. So in that, actually, we had a treatment protocol, and this was the treatment protocol. We classify the conditions into Vada Kabhaja and Vada Paitika, the autism patients. There were 10 patients, and Vada Kabhaja and Vada Paitika. And among Vada Kabhaja, Divana was done with Ashtajurna, in both conditions. Then we had Kalyanaga Krida and Vada Vaitika Tiktaga Krida. And in Abhyanga Ushmasveda, we selected Vadashini for Vada Kabhaja and Kshirabala for Vada Paitika. And Yogavasti we did with Pipalyadi Anuvasana Tailam in Vada Kabhaja, and Vada Paitika with the Madhueshtiyadi Tailam. So Shirodhara again with Vadashini, in Vada Paitika condition with Chandanadi. So like that, Shiro Lebam also, there were 2 combinations. And in Shamana Chikitsa, we also usually give Manasamitra Vadaga and Guluchyadi and Chandanadi in the different cases, and Kalyanaga Krita and Tiktaga Krita. In that way, actually we classify the cases into as per the doshas, and we gave the medicine like that. And we actually assessed the cases with the the childhood autism rating scale and the autism treatment evaluation checklist. So in that speech, sociability, sensory, physical factors, etc. were the main factors that we analyzed. And actually it was a case series only for about 10 patients, and it showed a statistically significant change in the sociability, sensory and physical factors. But the speech actually didn't have that much result, because it was only about 3 months before after study. Okay, so this we had published in IJEPR in 2017, and now actually, this is a case of autism, a classic case of autism, and you can see the stereotypic movements and the child, the stereotype, and he is not at all having eye contact. Okay, he is not having eye contact at all, and he is not looking. We are actually calling the child by his name, but he is not looking at all. Okay, so this is the time when he came to our hospital for admission. Okay, so this is the first scenario. And I'm sorry. Okay, this is towards the what discharge. When we are calling him, he's actually responding. He's looking at us. At least for a second, he's looking at us. Okay, so then after that, this is actually after 1.5 months. We usually have a package of treatment for a 1.5 month. So after 1.5 month, he just have an eye contact for at least 2 to 3 seconds and just smiles at us, but do not answer our questions. Okay, so this is the condition that we see after around 1.5 months of IP management. Okay, at the hospital. Okay, then I would like to see that the message or the theme of the Autism Day 2022 is actually inclusive education for all. So we have to look into, we don't have to always look into that management scenario alone, but we have to encourage the parents as well as that their patient or our patients themselves to improve their skills. There may be autistic savants. That means they have their own skills. So we have to identify their skill, and we have to improve that along with our already set medications and all. We have to improve their skill also. Okay. So likewise, we have a case where a mother is there. This parent actually is very encouraging. Actually, she wants her autism child. She is actually teaching her autistic son to write. Actually, he writes the books. Okay, he writes book, but the thing is that in a 200-page notebook, in one page he writes only one letter, and the mother has to just support the hand, and he will write. But he will have distractions and he will move here and there. But again, she forcefully she's that much encouraging. She wants her child to be a good writer. Actually, he writes very nicely, and I will show you the mother. What she does is, after the baby writes only one letter in a page, so she needs around 10 to 20 books for writing a sentence. And actually, he's a good writer, and he writes like a good story and all. Okay, so this is actually after around 2 years of our treatment. After 2 years of our treatment, he starts writing all these things. Okay. So this is actually the this is in Malayalam. Actually, this is actually the story that he has written. Actually, when we talk to him, he does not answer anything. Even when we call him by Adi, his name is Adi, but he don't respond. But he has written everything in Malayalam about our hospital, about us, about our doctors, and how he reached our hospital, and what are his experiences in our hospital. Like that, he has written many pages around, and he has also written a story. I mean, a short poem also about his mother and all. Okay, so we are going to publish that as a book now. It comes around 50 to 60 pages. His mother has translated. I mean, not translated. That's written more legibly. Okay, so these are the actually clinical. Sir told me to share my experiences. I presented it in a case series. The changes that we have noticed. So definitely the prevention, we are telling the parents or the patients to reduce their additives and coloring agents in their food particularly, and lots of fruits and vegetables, so that more antioxidants are there. And also food like takram, that means yogurt like things that will improve their gut microbiome, and reduce screen time. That is very important, because you must promote your child to interact with the persons. So that is very important. Spend quality time with your kids. As Prasad sir already told, we had actually conducted a survey among our patients during that COVID time. And we have found that almost 86% of the parents were happy, and the children also were happy that they could spend more time with their parents during that COVID time. Okay, so but they had actually lacked the therapy sessions of behavior therapy, speech therapy, etc. So if government provides actually more time for such parents to spend with their kids, and also actually we have to teach their parents, and not that we have to open the therapy centers everywhere. We have to teach their parents about how to do the therapy. That will be more useful. So this is what all I have to say. So we have to try to provide that inclusive quality education for all, which is the present theme. And thank you everyone.
Lakshmi, thank you very much for your wonderful presentation. Some of the cases, the short videos you showed were very, very, very impressive, particularly the first child in 1 month's treatment response. Now, there will be many questions again from people with us today. And I want to lead with one thing, just to give you a little bit of a clue. There is a lot of discussion about this Manasamitra Vadagam and management. So I won't look out for some questions that will come from a few of us in the audience and in the chat box.
Our session is open, sir. You can
okay, thank you. Thank you, Pawanji. I thought we had one more speaker, but that's it. So Lakshmi, thank you very much. Thanks to all our speakers for amazing presentation. Thanks. Before I go in there, I want to thank Pawanji, Agnihotri-ji, Vishnu Prasad-ji for working, and JSG for working very hard behind the scene to put this conference together. We call it a conference because the quality of the presentations and the emphasis and the timeliness makes it worthy to be called a conference. I have several questions, but before I do that, I want to invite Dr. Karthikeyan, and before that, Prasadji, if Prasadji is here with us now, Prasadji, to give us a little more about his experience, his wishes for the future. Is Prasadji here with us? So I just want to get some quick feedback from all our wonderful speakers today before we go on to some specific questions. If Prasadji is not here, I wish to invite Dr. Karthikeyan. We are very fortunate to have Dr. Karthikeyan, as all of you know, a very seasoned ENT surgeon with a passion for autistic care. And he has given us examples today of the work going on in Nagarkoil on the kind of things, the benefits that children are having from autism. Karthi, if you're here with us, please do unmute and share a few thoughts. Because Karthi comes to us from the modern medicine area, but deeply passionate about autism and also Siddha medicine. And whether he has learned something exciting today by listening to our Ayurveda expertise. Karthi?
Yes, sir.
Thank you.
Yeah.
So that's my question. You have said that we should all be working together, and this is the second time you have come to our platform and shared all of your experience and wishes. How do we take this forward? Your call is very important that we should all work together, and we are listening to that, and hence why we brought so many people here. We haven't got the Siddha Unani people here with us today, or the yoga people here with us today, but they'll be listening to what we would love to hear, Karthi, from yourself, how we can, where do we go in the next step? And when we meet again for the next Autism Day, what should we be doing based on all that you have heard today? And so that we move the agenda a little on. People are watching from around the world, Europe in particular.
So the main thing is like, should we ease the language of presentation? Because like the terminology sometimes can be
confusing for you. You mean the Ayurvedic terminology is confusing.
Yeah.
But okay, point noted, Karthi. This is, I think Agnihotri-ji will comment on this later when he comes to round up the session.
Yeah.
But I hope, Karthi, thank you for this. I hope Lakshmi and our other Ayurveda people, Renuji is here, whether they can comment something. You see, Lakshmi, the criticism is the modern medicine person says, we don't understand even simple concepts like rasadhatu, we don't understand it. And you go into complications like Agni, and you go into complications like they understand certain things. How can we make it easier? So this is also for Renuji. How can we make it easier for everybody to understand this? Karthi, from before I hand it over to our Ayurveda people, I'm wondering whether there is something that the modern medicine people, whether they can ask some targeted questions or something. Is that a way to start a discussion? Is that the correct way? I don't know, because we are all wanting to work together now. So that is clear. We don't want to work in isolation. We want to work together. Where would you like the input to come from to open this discussion?
So frankly, like I don't get any fantastic support from my own fraternity.
Okay. You mean from the modern medicine fraternity?
Yes.
Number one. Okay. But you can see the encouragement and the professionalism in the Ayurvedic community. Renuji, she's doing so much work. Lakshmi is there in Trivandrum, not far from, when you are going to Nagarkoil next time, maybe you can arrange to also visit Trivandrum, Government Ayurveda College Trivandrum, and meet with these people or invite them to Nagarkoil so that we can have
please do come to my center. You can touch and feel the whole thing. And it is a parent body, because as I told you, the DOST has given birth to UCOPE, which is the United Constellation of Parent Empowerment, because like I had given my technology to the parents to protect and then take it forward, kind of. Okay. So like anybody can come and feel, touch and feel, and then we are willing to cooperate. We are willing to try our technology in multicentric approach so that it gets proven. And then it is simple. The terminology is simple. And then another thing is like we have to work along with psychiatrists and the neurologists. The help from the neurologist is unfortunately lacking even for me. And we find a lot of difficulties in managing epilepsies and then seizure associated autism and comorbid conditions. And then all these things are overlapping things which deny the proper delivery of the treatment techniques. And then if they are, combined together, and still people are saying like medicines. See, there is no point in saying like these drugs have side effects, but we sometimes have to use those medicines to control the whole thing. And so this is what practically I feel, I face every day. And the Autism Awareness Day should not be on a single day in a year. It should be 365 days. Because the numbers are more, and we tend to forget, and then the agony that the parents undergo is unimaginable. And I'm only addressing the parents' plight. What happens to my child after me? And
Karthi, I just want to stop you there, because in Trivandrum we are very lucky to have people like Lakshmi there. Number two, we also have a national center of excellence in Sri Chitra Center, and so the question I'm going to, which is very, very special place. So I'm going to take your question and connect it to a second question and ask Lakshmi ji whether whether you have any contact from Government Ayurveda College. So Karthi is saying he doesn't get any support even from modern medicine people. Now the question for you is, in Trivandrum, when you have all these resources, do you connect with the Sri Chitra Center or some other place with the modern medicine doctors? Could you tell us a little bit?
Sure, sir.
Unmute, please.
Can you hear?
We can hear you, Lakshmi. Thank you.
Okay, so actually, our center, Government Ayurveda College Trivandrum, the Department of Ayurvedic Pediatrics, has been working in this field from around 2000. Actually, it is now around in the field of developmental disorders, all disorders like cerebral palsy, autism, ADHD, epilepsy, etc. So in our hospital, actually, we have both Ayurveda and allopathy doctors working together in a hospital. Actually, when you come to our OPD, outpatient department, you will be asked a question, you want to see Ayurveda or allopathy.
Mhm.
So our means we are working with the gynecologist and the pediatricians of modern medicine, the conventional medicine. So if our patient with an epilepsy, cerebral palsy patient or an autistic patient having epilepsy, sometimes get an attack of status epilepticus or something, we actually take the help of our pediatrician. And they actually refer such children with developmental disorders to Ayurveda. So in that way, we are working in though sometimes there may be some ego here and there, that is usual. We are all human beings, no? But still we are working in
Integrated way.
Professional.
Lakshmi, I have a question for you. This is also Karti's, I'm reading his mind. He's also asking a question in his mind saying, who is paying for this modern medicine doctor who's working in your...
No, it's a government hospital, sir.
Government hospitals.
Yeah, so they are actually appointed by the government, by the Department of Health Services, and we are appointed by the Department of Ayurveda Medical Education. So we are all government doctors, and we are working in a center in one room. So the superintendent of our hospital is actually an Ayurveda doctor.
Okay.
So, and they are working under, and actually, sir, the pediatric neurologist of Medical College Trivandrum, actually we are referring our, sometimes people come to us without taking anti-epileptic drugs and all, because and they are having continuous seizures, but the parents are reluctant to take anti-epileptic drugs. But if they so sometimes when we admit, no, they will have definitely status epilepticus like episode. So definitely we need to take the help of a neurologist. We cannot stop this. We cannot stop the status epilepticus suddenly with an Ayurvedic drug. So what we do is we refer them to a pediatric neurologist of Medical College Trivandrum, and sometimes patients come from Srijitra also. Srijitra, we don't have direct involvement, but Medical College Trivandrum pediatric neurologist, we have direct contact.
Okay. Thank you.
We'll work.
Lakshmi, I just want to get some quick feedback from Karti ji. Looks like Trivandrum is very well advanced in this kind of integrative thing that Karti finds difficult in Chennai. Is that correct, Karti? Am I reading this correctly? Because you are an old student of a very prestigious Stanley Medical College. You're a very prestigious medical college in Chennai, very old medical college in Chennai. And I feel a bit disappointed to hear that the modern medicine fraternity are still not joining you in your effort, although you are doing excellent work.
It's not a question of they joining me, because like the environment is different. See, there it is the same institution under which everybody is working for the government. So the interaction is coming without any inhibition. But I'm working on a private kind of setup, and many neurologists feel when I intervene with the traditional Indian system, they coming and then helping me will put them into jeopardy, because many doctors have reservations on the traditional Indian systems of medicine. But Dr. Lakshmi does not have that particular problem in her work environment.
I think that is a very, very important point. Karti, please keep that question in mind, because Renuji in Varda is located in a place that has both modern medicine and Ayurveda within the same institution. So I want to hear Renuji's comments. Renuji, namaskar.
Namaskar, sir.
इसके बारे में थोड़ा बताना जी. अंग्रेजी में बताओ तो कार्तिक जी की समझ आएगा. थोड़ा सा. The question is, how much help do you get from modern neurologists? Because you are in Varda, you have the Modern Medicine College, and your, please tell us, based on
Yeah,
Lakshmi
we
ji has
used to
told us very active interaction between modern medicine, Ayurveda people in Kerala, in Trivandrum. Please tell us.
Yeah, we used to refer our complex disorders to allopathy side, but they usually don't refer their patients such developing disorders or developmental disorders or CP or seizures or not seizures particularly, but autism or a hyperactivity. They do not refer such children to our institute. That is the big difference. It's only
Renuji?
unilateral way.
Yes. Unilateral. I think I can see Agnihotriji nodding his head. There is Agnihotriji. Would you like to comment very quickly before I see Prasad ji has joined us from Palga? Prasad ji, namaskar. Agnihotriji, please, if you want to just say a few words about this issue, this
I think
hospitalization.
Okay, thank you. I think Dr. Rathi is rightly pointing out the thing. It is a unilateral, but it can be generated to bilateral. Because the discipline which is followed in Lakshmiji's college, hospital, and Dr. Rathi's hospital, the same pattern and discipline is very much there in BHU. So we are lucky enough that we are having both faculties, and we are having the hospitals of both faculties run by the Ayurvedic in charge and allopathic in charge. We very cordially refer cases to each other as per the case be. When modern medicine persons feel that this is a case of UTI and not giving good response out of the so many antibiotics, they refer us. And we, with our Varnadi Kwath and other things, with Gokshiraj, Gogulu, etc., apply them, and we get a wonderful response. And they notice it with all appreciation. So there is a very good cordiality. As far as the surgical things are concerned, we refer them, and they do our required fulfill. So this point is my submission. But at the same time, I would like to add one more thing, that I was listening first, Mr. Prasad sir, and just when our Kartike sir spoke, he changed the total scenario with the view that he has got a different concept over this autism. Resultantly, he came forward with that it is an inflammatory condition, inflammatory disorder. So though he is coming from Siddha, I think I may be wrong. At the same time, he also talked about that he is an ENT surgeon, I think.
Yes.
So thank you. So in that way, what I found that you talk so much, but as far as this, if it is an inflammatory, that too neuroinflammatory disorder. So what we read and we understand that the nose is the gateway to brain, and brain is the master of the whole nervous system. So can't be this nasal passage be used in the form of the snuffing or the nausea? Though afterwards the speakers made my doubt very clear. But these two ladies, these two speakers made something very important. The way they described little such type of symptoms may be there in every kid. Crying, little bit crying, insisting, disobeying the parents for certain reasons or so, or spoiling the papers, making this thing, that thing. So I'm scared. We have got our grandsons, and also, so they small up to 3 years, I think they are at liberty to perform the activities as per their own choice, and 75% parents appreciate it, as long there is any wrong thing say perceived by them. So I think this is the whole of the thing is that Kartikeya sir made clear. Could it be possible to proceed with the nasal route also for the correction and for the betterment of this autism kids? Thank you.
Karthi, this is a question for you about Nasya, and which we have talked about already. But before Karthi ji, before you come on, I see Prasad ji is here. He has joined us. Prasad ji, namaskaram.
Namaste, Madanji. Namaste.
Namaste. Thank you so much for joining us.
I had to leave in between after the presentation because I had another session.
Much appreciated.
So I couldn't make it for the full session. Really sorry for that.
Much appreciated. But we want to, Prasad ji, the question now, you are having a situation running a center very much like Karthi ji in Nagarkoil and in Chennai, and you are developing protocols, you are developing new thinking about the Agni, Ojas, Manas kind of protocol, which is very, very creative, original thinking. And this interaction that can happen, there are more interactions that we must enable. So I just want to know your opinion on how these interactions can be speeded up. I know you have very, very forceful thoughts on many of these matters. You have listened to how in Government Ayurveda College Trivandrum, there is a cordiality between the modern medicine people, and the government has enabled that. And how can we do this, extend this to go into, I think Lakshmiji in one of our earlier presentation mentioned about interactions with RGCB to look at the microbiome, et cetera, et cetera. But how can we make more vibrancy so that we negate the difficulty that Karthiji is saying, that Trivandrum seems to be in a very advanced kind of position with government helping, and Kerala seems to be in an advanced position. Maybe you have some experiences also in how you connected with the modern medicine people, number one. And how can we encourage governments to do a little more in other areas also, in the research areas, neuroinflammation that Karthiji and that Agnihotriji have just raised again. Please share us your free thinking here. Please be critical. Please be candid. Please be open, so that we get something here to think about and take forward.
Okay, definitely, Madanji. Actually, what I have felt is this way of explaining things are different. That could be the only point which is important here. We may be doing the same things. I have many examples and experiences in that regard. What Dr. Karthikeyan was doing, I think, is definitely a different thing that a modern medicine person focusing on an integrative approach and trying to do things in a different manner. And he is not enjoying the support from his own fraternity for reasons other than medical, whatever it is. Dr. Lakshmi is doing something wherein I think Ayurvedic people are doing things, modern people are cooperating with them. I do not know how cordial the relationship is, because in general, the relationship between Ayurvedic people and allopathic people in Kerala is not that warm, that cordial. Anyway, I think under a government machinery, it is operating. I have quite a different experience. See, Cochin University of Science and Technology, Department of this Neurosciences, they were ready to take up my protocol, Sunetri protocol, for an extensive study. So that was a golden opportunity, because I'm not in a position wherein I am obliged or I am forced to explain my experiences, my approaches, my basic principles in a language which is not at all familiar to me. But they gave me the freedom to do things with my own logic, my own conceptual clarity and everything. Whereas there will be 3 arms for the total study. One is I'm doing everything clinically in my own perspective. There is another arm which will be assessing the clinical outcome from a different perspective. Of course, they are not medical people, but they are people of neuroscience. So the sort of professional friction is not there. And a third arm will be doing the same set of medications and other interventions on an animal model, in which the brain will be studied and also the cell line in the gut will be analyzed. So that was a wonderful project, and that was I had great hopes, but unfortunately that in spite of the best project submitted, due to the cost factor, it is still pending. Nobody is there to fund the project. But what I mean is that sort of things are possible, in which every professional has got the freedom to do things in his own perspective. He is not under compulsion to explain his movement in a language which is totally strange to his thought process. Meantime, there is no preoccupation in the evaluation, which is open. So that sort of a model is going to make miracles. When Ayurvedic peoples are repeatedly asked for evidence, I think they are supposed to generate evidence which is not under their purview. They cannot do the evidence making in a methodology which is quite alien to them. So that is the problem. Egam sad vipra bahudha vadandi. Satyam is egam sat. But the ways of explanation are different. So what we require is more opportunities to work together, understand each other better without prejudices. That is what I have thought. And I'm quite eagerly looking forward that Cochin University project to take off. And I hope that will be a game changer. Thank you, Madanji, for this opportunity.
Prasadji, please stay with us, because what you're pointing to may be a call for a national initiative for autism and the integrative approach. Maybe that is what should come out of this. You're talking about funding, limited funding, need for having everybody working together, but working independently, and then having a structure. And maybe that is what we are pointing to. Please stay with us, because I want to see if Karthiji wishes to comment on that. Whether Karthiji wants to comment on what Prasadji has just mentioned, that everybody has their language, they must work independently, but work together. Is that a formula you are Karthiji, you have to unmute. You are still muted. I think Lakshmiji.
I have to tell you, that formula has failed on my path, And so I have developed my own physiological markers. I have developed my own assessment techniques, and we have weekly assessments along with parents, and then we have tabulated physiological markers, and we cannot depend on a neurologist to come and assess our children whether it is improved. We have different unbiased assessment environments. See, when the child cooperates for venipuncture, see, we do biochemical analysis every 6 months, and 6 months down the line of the treatment, the child cooperates for the drawing of the blood. It is assessment plus. And the boy sits for the haircut without making trouble, there is an assessment. And the boy, the ADLs or assessment. So when we treat those children in our own methodology, we have to develop our own physiological markers to assess the improvement. That is one thing. And any neurologist or a pediatrician that the child goes can be kept in dark about the treatment given, so that the doctor will comment, oh, I see the boy a little more better than what it was before. But what I find in my experience, if the doctor knows that he comes to so-and-so center and then takes Indian system of medicine, their comments are reserved. And then they do not want to accept that there is a improvement in this treatment methodology. Possibly that is confined to the geographical zone in which I'm working. It may be different in others' perspective. And depending on, talking about Dr. Prasad's project, this is what I faced with the DST and other funding bodies. They are reluctant to fund such pilot projects. They ask for whether you have a pilot, because I'm riding my own path. Where will I have a pilot? And these techniques have been practiced for centuries. And then they ask for evidence-based this thing. Practice for centuries itself is an evidence-based thing. And these things are not in their rule book. And so I stopped fighting with these people. I go about increasing the volumes.
Karthi, thank you for being so clear again, because as you well know, all of our events are being live streamed and recorded so we can revisit. I will push a few more probing questions so that we get the comments that can be converted into a concept note. I think Lakshmi has got the ball rolling for us by saying we have a Kerala model, which is very exciting. And Prasadji has given us a real example of QSAT, which is a very highly rated university in India. I think it's number 44 or 45 in India, Cochin University of Science and Technology. And Renuji has given us her comments about what happens in Maharashtra, about unilateral kind of interaction. And Agnihotriji has given us a little more about a BHU model where things are happening quite nicely. Now, I want to change the, take Lakshmiji, just listen to this question today. It is in the chat box. It's from Rajesh. Rajesh, namaskaram. Please join us. Namaskaram. Please tell us a little more about yourself. Your question is on the chat box for all of us. You've heard from all the experts doing exemplary work in autism at very high levels of excellence. Prasadji in Sunetri developing protocols, Lakshmiji in Trivandrum, Government Ayurveda College Trivandrum, working with modern medicine people, Karthiji in Chennai with a center in Nagarkoil doing excellent work, and Renuji in Maharashtra doing amazing work. Unfortunately, we don't have people here from Karnataka, but we know SDM Hassan and Suhash Shettyji now in Belgavi is doing excellent work on autism and related matters. We also know in Kotakal, Parvati Deviji, who should have been here with us today, has a lot of experience in this area. So it is not that we are not having experts with many hundreds of man-years of experience. So cumulatively, we have many hundreds of man-years of experience. So if people are not listening to what is being done, it is their fault. And we will make sure they listen to this now. When we collectively, we have many hundreds of years of man-years of experience, number one. So Rajeshji, thank you for joining us. You are joining us from Peterborough, which is very close to Cambridge. Please tell us about yourself, and your comment here in the chat box is a very difficult, it's a very difficult one to read, in that that there is nobody here who's able to help here in the UK. Please tell us a little more, Rajeshji.
Yes, sir, definitely. First of all, I need to thank everyone actually, because I have joined this chat without any idea like what is going to happen here. Because I just saw an WhatsApp status from Sunetri group, and I just joined at the moment actually.
Thank you for joining. Thank you so much for connecting with networks like Sunetri's network, and thank you for being so quick to join us today. We look forward to your thoughts and comments. Number one, some thoughts on today's presentations. Number two, about your own situation. You are a parent of an autistic child in Peterborough. Please tell us, Rajeshji.
Yes, correct. Thanks for that, sir. Because to be frank, my kid is around almost 6 years now. So I have been fighting with this from last 6 years, I would say. I have been talking to multiple people, and I have been to many doctors, and even I had a chat once with Sunetri team. So I have been to homeopathy, Ayurveda, allopathy, and everything. We have tried many things. But to be frank, nothing is working till now. But I can strongly say this is the first session where I could see a lot of expertise, and I got a lot of inputs now, even from Ayurveda and allopathy and every kind of, and each and every corner of medication. That's what I can say that. Because the reason I have I posted the question is as you know already. So we don't get any support here in the UK, especially for my autism kid. Now, apart from this EHCP plan, which is in progress for my kid actually, to get that special school and all. No any therapies here, and no any actual medication going on. However, we are trying some speech therapies, occupational therapies from India, that is remotely through video sessions, which is not working for him completely. However, but because I'm in a different phase actually, because my son has been diagnosed at the age of 3 with an autism. So whenever I started going through Sunetri, or whether through some occupational therapy or speech therapies, the lockdown came actually. So we left with no options actually, because my son was in the indoors for almost 2 years. So he has crossed that what I say golden period of 5 years now. So we are staying in the UK with the hope of at least he'll get some special education or special schools or some better support than India. That's what I feel like now. Because I came here for an initial for a short term. Then I felt like special kids will have some special treatment here in the UK. So I thought to settle here for a long-term basis. But I don't know how, to be frank, I don't know how can I deal with it going ahead actually. So I'm going to each and every corners of Ayurveda, allopathy, and each and every base.
We are very grateful, Rajeshji, that you have joined us today and you've heard from the experts a lot of collective experience here. Now, I'm assuming you are originally from India, and I'm assuming, what is your native language? Now, the reason why I ask this is, are you able to connect with Karthiji in Chennai or Nagarkoil? Would language be a problem for you if you had to go and spend some time?
I'm from Tirupati. My mother tongue is Telugu, but I have been graduated from Tirunelveli, so Tamil is not a problem for me.
Tamil is not a problem for you. Okay. So that is first comment, Rajeshji. Number two, would you be kind enough to put your contact details on the chat box? Because I know Prasadji has your contact details, but if you are happy to share your contact details here on the chat box, then all our experts here will be able to interact with you directly.
Definitely, sir. That would be a great help.
If you are happy to just put it on the, okay, you put your email address, and I don't know if you wanted to share your WhatsApp number or something, then people like Lakshmiji will be able to, chat with you and ask a few questions, or Prasadji is already in touch with you, or Karthiji will be able to just chat with you and ask a few more questions. So number one, thank you for joining us today from Peterborough. Number two, thank you for sharing your wish. And thank you for sharing your details, which is wonderful that it's all here now with us. Please stay with us because we have Dr. Vaidya Harish Vermaji joining us from Toronto. And Harish Vermaji is a very seasoned Ayurveda practitioner with a deep passion for integrative approaches. Harish ji, namaskar.
Pranam sir, pranam.
Namaskar.
मैं आज क्लिनिक में हूँ
आज रोशनी थोड़ा कम है जी आपके इसमें.
It's a clinic actually.
Acha, clinic mein. Chalo, we will at least, we will listen to you. And please, you had 3 questions, very targeted questions. The experts are here. I think the questions are already in the chat box, but the floor is yours, Harishi.
Yes. So I listened partially because there's a lot of rush, and I'm continuously I'm listening. I want to share my experience about autism, since I am working in field of autoimmune diseases for the past many years. So there is one study that autism is also connected with autoimmunity, and I'll try to share one of the if there's an article. So this is the article, Immune Dysfunction and Autoimmunity as a Pathological Mechanism in Autism. So, and it has been seen that in one group, patients responded very well to, 46% patient, it's a group. So what I want to discuss in my practice of many years in autoimmune diseases, I have found that some immunostimulant herbs, sometimes they aggravate the disease. This is the caution. We have seen in cases of this autoimmune hepatitis, there was a report that Tinospora cordifolia aggravated the symptoms and it damaged the liver because it is, I have seen in my practice also, some of the strong immunostimulant herbs, they can also damage, they can aggravate the disease. So I want to draw attention of all the experts that this is also one area where we can see sometimes the child are responding to major drugs mentioned in Ayurveda like Bacopa monnieri or Centella asiatica, Brahmi or Mandukparni. But sometimes we add Tinospora and other herbs. Sometimes they may get aggravation of the disease. So this is one aspect I wanted to share with the audience, that autoimmune factors should also be considered. And the second, I posted the question regarding the Shirodhara. It's a challenging to do Shirodhara in autistic child.
Harishi, thank you. Your question, you 3 questions. I don't know, it is open to everybody. I guess your questions are very clear. I don't know if
First of all, they do not cooperate.
Lakshmiji, do you have a comment, or do you want to respond to this? Or Renuji wants to respond to this, or Karthikji want to respond about Shirodhara? And
Yeah, I
how
want
you
to respond.
Lakshmi,
Yes,
please, please.
Sir, sir, actually, Shirodhara, we are doing towards the end of the procedure. Initially, the child, actually the main problem will be the first treatment. That means the autistic child coming to the hospital for admission, and they are taken to a Panchakarma theater, and they being they get accustomed to that Panchakarma theater. So in the first 2 days, actually, we are finding it very difficult with the starting of the treatment. And gradually they becomes accustomed to that Panchakarma theater where we are doing the procedures. And we are doing Shirodhara only towards the end. Say after around 20 days or 25 days of getting their treatment in that same Panchakarma theater. So nearly after 25 days, they will be almost used to that environment where they are doing that. And in the first day, definitely there will be difficulty in doing Shirodhara. Actually, we are doing Shirodhara for all autistic children. Most of the autistic children that they are coming to our hospital, and maybe the therapists are well trained, or sometimes we may have to use some gadgets. Sometimes we may have to show them some videos or something for making them lie down. And after lying down and doing that dhara for some, say, 5 to 8 minutes, they will actually become calm. So I don't think that much difficulty is there. It's only in the beginning.
Thank you. Thank you. Lakshmiji, thank you. I don't know, Harishi, is it satisfactory? Is the answer?
Yes, actually, there is one company in Japan. They have modernized Shirodhara. They have made a robot to do Shirodhara. So it's a robotized Shirodhara. We can make some arrangements to make a Shirodhara, and we can do it in a very controlled way. And they monitor. They made a machine like CT scan machine. I'm in hurry now because a lot of people are now knocking my door. And so one day we will have a complete webinar on Shirodhara. Where in West, there are a lot of electrical machines are also available for Shirodhara. We can control it. How to give Shirodhara to the children. It's a challenging, particularly to the autistic children.
Harishji, before you go away, I know you have patients today. Before you go away, please could you give us the PubMed ID for that paper, or the title of the paper on the chat box, please?
Yes.
The paper that you offered us. I think we deeply appreciate your information sharing here. We all would love to study that paper on autoimmune responses too.
I'll share, sir.
Thank you. I know we can take it from our recording, but it's a bit difficult going back into the recording and then finding out where. But if you
I have shared, sir.
Okay, thank you.
I've shared.
Got it. Thank you. Thank you so much.
So I'll be listening. Thank you, sir. Thank you.
Thank you, Harishji. Thank you. Your point about aggravation of autoimmune conditions with specific herbs is a very important point. We are having that confusion that we have about Tinospora cordifolia, Guduchi, and liver problems is still on the burner. We haven't forgotten it. We are working on it. Your point is well noted here. Thank you.
Thank you, sir.
Thank you, Harishji. Please stay with us and listen to us as you continue.
Madanji, for little clarification about Tinospora cordifolia, it can be used in juice form, it can be used in raw form, it can be used in sattva form. That is Guruchi sattva. it is very minutely, even in delicate condition also, it can be used. I don't think that there will be contraindication for Guruchi Sattva. It may be, even I cannot support totally that Tinospora cordifolia has got hepatic disorders as a contraindication. I cannot be convinced totally. Whenever such problems arise, you go for Sat, you go for Guruchi Sattva. If you want to select that, because you people outside India are accustomed to go for one single drug therapy. And whereas there are number of combinations and number of presentations, and in a different way, according to the constitution, you can change the mode of administration.
Domaji,
Also.
Your point is very, very important here, that we have so many different ways in which we can do the preparations. Now, Domaji, now that you have activated your microphone, a question here. This is about the Manasamitra Vadagam. And could you, because I know in one of our earlier presentations, this came up, there was some discussion, and you said this is not to be given for small children. Could you touch on that point again, T?
Perfectly, Madanji. Actually, it's a combination which is meant for adults only. It is not for pediatric. And I do not know, for a children of 8 years, will be served Manasamitra Vatakam. For the first time, I heard from Australian practitioners. Wonderful. Nobody, I think, that genuine practice in India, in Bharat, I say Bharat, will go for such prescription.
Now, what, Domaji, please wait 1 second, because we would like to hear from Lakshmiji about, Lakshmiji, there is a big story behind this. Just like the Tinospora cordifolia problem, we had a case, you all know in Kerala about the problem that happened in Australia and the difficulty with one Vaidya that was unfortunate. And Domaji was very quick when he heard about this thing, saying, at least in Telangana, where Domaji is, nobody uses Manasamitra Vadagam for children. Now, please tell us, please enlighten us. I think Prasadji will also have some comments on this. I think he's smiling about this. I start with you, Lakshmiji, because you raised this point. Please tell us. Number one, I'm going to push you a little bit about that Australia story. Could you tell us a little bit about your interpretation? Number two, Domaji's point, which is generally used in adults. Why is it being used in children? Or is there a variation? Do you vary the dose, or do you vary something, or do you use it differently? I think the same question also for Prasadji, just a little critical, but please be open. Please share your thoughts so that we can capture these things.
Sir, actually, the Manasamitra Vadagam contains almost all heavy metals. Swarnam, Rajatam, Tamram, Loham, almost all heavy metals. That is gold, silver, iron, everything is there in Manasamitra Vadagam. So that you should be aware of that Manasamitra Vadagam contains all these heavy metals. And second thing is that it should be prepared by a company that prepares the combination in a correct manner, as explained in the classes. So that should be taken care of. And the Anupana, it is explained that, the adjuvant, that it should be given along with milk only. So the Manasamitra Vadagam should be given along with milk. And we have been giving Manasamitra Vadagam for patients with Unmada. Definitely, that means who are diagnosed with Unmada. That is, sometimes it may be ADHD or autism or other behavior disorders like obsessive defense disorder or like disorders. So behavioral disorders. So for that children only we will give Manasamitra Vadagam. And till now we have been practicing it, I think for last 20 years in our department, we have been giving Manasamitra Vadagam.
For children?
Yes,
for children?
We are actually from pediatric department.
Okay.
Ours is only a pediatric department. Okay. So we have been giving Manasamitra Vadagam for the last 20 years. And till now, even we have our patients who are now 25-year-old and working somewhere or like that. Until now, we don't find any adverse drug reaction. I have no adverse drug reaction have been reported till now, but you should be careful about the dose and the adjuvant. And along with that, you should be aware that this contains all that heavy metals. And if you add other medicines also that has such heavy metals, say you are giving along with that Shwasanandan Guliga or any other preparations that contains the same thing, then you should be aware of that. That is the only thing.
Lakshmi, another question now before you go away, before we just move the microphone to Prasadji. Question for you in Trivandrum, Government Ayurveda College Trivandrum. Your preparations, your Basma preparations, or all of these, are they made in the college, or do you buy it from somewhere, or how? And particularly the Mansamitra Vadagam, where is it from? I'm asking this because we just want to feel comfortable about.
Actually, it is being supplied by Aushadhi, which is the government government company which are supplying the medicine for Ayurveda.
Thank you for pointing us to the source, which is in Thrissur. Aushadhi is, as far as I understand, it is the largest government undertaking for Ayurvedic formulations and a very, very respected manufacturer in Thrissur. I will put the website here on our on the chat box. Domaji, we'll come back to you, but I just want to listen to the thoughts from Prasadji. Prasadji, this issue about, number one, the difficulty that happened in Australia, the challenge from Domaji that Mansamitra Vadagam is used more for adults, should not be used for children. And Lakshmi ji is saying, we've been using this in children for so many years, we don't have any problem. So please.
Interesting. Actually, as far as Mansamitra Vadagam is concerned, I think from area to area or region to region, the style of practice is different. In Kerala, as rightly pointed out by Dr. Lakshmi, Manasamitram is prescribed even for kids. We use it. Of course, it doesn't mean that we use it extensively like any other Kashtaushadhi without any control, nothing like that. It is, of course, a powerful medicine. It contains, as Dr. Lakshmi mentioned, many ingredients which can turn out to be toxic if handled in a careless manner. So that should not happen. That is the same case. That is the case with many other medicines. But I think it is the responsibility of the Vaidya to make sure that he is getting good quality medications and it is prescribed rationally. So I personally prescribe Manasamitram Guliga to kids of any age, and I have not met with any adverse effects till date. Regarding the Guduji, should I say something about?
Please, yes, please.
Okay. Regarding the Guduji, I think after the COVID pandemic outbreak, I think Guduji has become a hero as well as a villain. Because Guduji was used extensively as with a nickname that, okay, it is an immune booster. I don't go to the technicality of whether the immunity should be boosted or not. That's another question. But I think even the government of India tried its level best to promote certain herbs as immune boosters, and they became popular like anything. And that has created a lot of unrest in the pharma industry, by and large, from the Western pharma industry. And they have made a very aggressive attack on certain herbs, including ashwagandha. Meantime, I should also say that to meet with the huge demand for Guduji, I think it practically became unable to meet with the demand, and a lot of malpractices also happened. Various types of Guduji, that types like Tinospora crispa, that sort of things were flooding into the market, to the industry, and that has created a lot of bad impression about the way in which it is used Again, I think ideally in the classical way, Guruji should be used without the skin. But when the demand is so huge and the regulations are so poor, I think the industry was becoming a little bit careless about it. The Guruji stem was used with the skin intact, and that is not supposed to be the blame of or the issue with the Ayurveda or with the Guruji, but it is with the improper usage. Regarding Dr. Ramaprasad's case in Australia, I think, to the best of my understanding, there are many other factors which were playing. Of course, he became I think, of course, it gained a bad impression about his personal career as well as the system. But I think you should know that, you see, next week there is a program going on to happen in Australia about, that is, the name is called Aushadhi, I think, or Aushadhi or something like that, in which the Australian herbs are tried to be identified and how it can be used in the Ayurvedic practice also. So I think it is not going to terminate the use of Ayurveda completely in the country Australia. But I think there was a setback. But again, it is not because of the system or the logic behind it. But of course, the industry, something went wrong behind the screens. That's all.
Prasadji, thank you very much. You're always very sharp in outlining the problems, and always you give us a very comprehensive reply to what we need here. You know, the general practice here, Lakshmi, there's a feeling here that any Aushadhi in Ayurveda can be used as a OTC, over-the-counter formulation. No. And in many of our discussions earlier, you know, particularly Harish Vermaji has said that there is a need to start to make certain formulations, particularly these very important formulations, very complex formulations, as a prescription-only drug. You know, they will not be available. And those are regulations that must come into play in India, where there are certain formulations that cannot be had unless it is under medical supervision, or even Ayurvedic Siddha medicines. There are many that should only be on prescription, and there may be many that are OTC, but there are dangers associated with that too. I think people don't understand that these formulations are medicines. You know, they're not food supplements, and there is just misunderstanding of what is a medicine, what is a food supplement, what's the therapeutic dose, etc., etc. And a lot of people here don't understand that when you go to study Ayurveda, you're committing 6 to 7 years of your life initially to get the first degree. And then, particularly in established institutions like Government Ayurveda College Trivandrum, a very old institution, it is a very rigorous training. And then you have to do another 3 years as an MD. So that's almost 10 years, 9.5, 10 years of education before you can start to practice with confidence. And over that period, you are also working as an apprentice with the senior Vaidya. Most of you have spent time with somebody, you know, going every day in the evening or spending a few days a week working with somebody and understanding how they treat patients. So that image, that understanding has to be changed here, in particularly in broadly use the term the West. And so whenever you people are using formulations, it is after a lot of training and a lot of understanding of the deep principles, you know, especially Rasa Aushadhis, etc. It's a very, very, people don't understand. They think Ayurveda is just some leaves, you know, the image of grinding leaves and then just putting some oil on your skin. They don't understand this is a very powerful way of therapy. So that is one point. I noticed Domaji, I want to see Domaji whether he has, it's a very controversial area because Domaji will commit to saying it should not be used in children, but you are saying we use it routinely, we use it safely, and we have a lot of experience. Domaji, please, very briefly, because we have 1 or 2 new people in the platform, we would like to draw them also into the discussion.
Madanji, it is nothing but Sahasra Yoga.
Sahasra
Manasamitra Vartakam is the formulation out of Sahasra Yoga.
Sahasra Yoga.
And Sahasra Yoga is much practiced in Kerala.
Yeah.
Very less outside of Kerala. And nowadays, people in Karnataka, especially in Bangalore, they are using much of Kashayas out of Sahasra Yoga only. Much
Domaji, please
stay. Likely.
Please
One more thing.
Please.
What Prasadji had mentioned, it's perfectly right. The Tinospora cordifolia, the layer outside the Tinospora cordifolia should be peeled off. Then only it should be used. Even to, as a vehicle, whenever I say to patients to use, I ask them to peel off that layer, then only it should be used. And likely there are so many things in Ayurvedic system where the relevance combination should be there. And mostly what my experience, what my practice is concerned, I go for bhasmas for children, especially, not rasayanas. If they are rasayanas, selection of rasayanas, they should be out of only for Balaroga Chikitsa. Out of that chapter only I selected. For example, Kanakabala Suryodayam, Vantabala Suryodayam, like that. They are especially pediatric combinations. Then we can. And likely, if at all a physician commits a mistake with the irrelevant of combination, then it cannot be guilty of the therapy. It is the guilty of the practitioner. And another thing is there, wherever such a case takes place, such happens, immediately they raise a question of manufacturing section. What nonsense! If manufacturing section is to be questioned, would they survive in the market for years together? Where your mistake should not be should not be reflected with the manufacturing section. Okay, I don't say, I don't give you a presidential seal to manufacturing all, because there was a controversy previously also on one day about that should not be taken into granted. Like that, okay, you go for analysis, but whatever mistake, whatever that means critical condition arises, immediately they need not blame the manufacturing section.
Domaji, thank you. I want to we want to come back. I think Agnihotriji wants something urgently. He's wanting us. Please, Agnihotriji.
Sir, thank you. Sir, I would like to come with 2 points to put in to a floor for discussion. Though we have started from Autism Day, but again this Giloy or Stradiforma is now came in discussion. So I would like to go for with Dr. Harish Sharma, and again I would like to go with Dr. Domaji, because today itself I visited Patanjali Institute of Ayurvedic Teaching and Research, and willingly I visited that Devagun department, and with the senior professors I pointed out this thing which was already there in our previous webinars. I found the extent of Harish Sharmaji is quite correct, because the different species has got their effect and after effects. Accidentally, it was found as a means depressant and leading some harm to the liver. As far as the other hand, it is good and safe. As far as the Sattva Giloy Sattva, Amrita Sattva is concerned, it is completely safe to the indications it is meant for. And the other question which I put in my check box is regarding the effect of solar eclipse or lunar eclipse to any of the kids who are suffering from autism. Both the learned doctors, both the lady doctors, I mean Dr. Lakshmi and Dr. Renu Rathi, might be being ladies, might be having a little bit any study or concept to enlighten us. Thank you, sir.
Thank you, Agnihotriji. Thank you for mentioning about your interactions with people in Haridwar. We would like to bring them.
There was my guest lecture for the motivation of the first year new students entry. It was 100, so I was called as a guest speaker there. So I have got time to visit all the departments. In that way, it was a point in my mind that I have to discuss to whom. So our head of the department, they've gone professor and all, but there. So we had a good time to discuss this thing. Okay.
I hope in future programs we can also bring them into our platform, so that, because they have a lot of experience.
Sure.
It's an information sharing opportunity, like what Harish ji has shared, that the paper on autoimmune responses and autism. Thank you, Agnihotri ji. I think Agnihotri ji's question is in the chat box. Let me read this out, because it goes into this area. Lakshmi is only here with us. I think Renu ji has left us now. Prasad ji is here, Karthi is here. So the question from Agnihotri ji is there any data or study on pregnant ladies, pregnancy period, which is around the solar eclipse? It's an interesting one, and it says in reference to autism condition. So that means Agnihotri ji is pushing us into the subtle domain, the aprathyaksh area. Where else can we see some other influence? So beyond genetics, beyond epigenetics, beyond microbiome, and going somewhere else towards the avyakt. Somewhere between the vyakt and the avyakt is a long area of possibilities. Am I correct, Agnihotri ji, that there are many things here between vyakt and avyakt?
I think you use your brain in excess. you overburden your brain to take out such a complicated thing in an easy manner, and such easy things in a very complicated manner. This is what your beauty of intelligence. Really, we are all fan of it, and really, this is what you manage the things. Really, it's a challenge that one should be jealous of it. Thank you,
Lakshmi ji. So we are unmute yourself, please unmute yourself. And Agnihotri ji is pushing us towards this understanding of Sankhya. How well are you understanding Sankhya, and how are we connecting it with daily practice? So there you are, a good challenge from Agnihotri ji.
Actually, sir, we haven't till gone to that level. That means we haven't inquired about that effect of eclipse and all in pregnancy. Because in different people, when we even there will be it will be a retrospective questioning will be,
of course.
So
ma'am, right now onwards you can collect some information that whosoever is whosoever mother is coming with their affected kid suffering from autism, you can go through whether you have completed your pregnancy of this kid. Had there been any solar or lunar eclipse, because solar eclipse has got the much more effect, as it is said in our text or shastra. So in that way you can get as a family history point of view or personal history, you can make a one extra column for this, the pregnancy and the whole of the ANC period. Had there been any eclipse, so you will at the end of this, say 10 years or 5 years or 1 year, you will be having data. Yeah, thank you.
We'll try, sir, but till now we haven't done any such work. Till now, we have actually gone into the physical as well as the psychological aspects. Till now, not gone into above that level.
Lakshmi, here, thank you for clarifying. But I think Agnihotri ji's comment is maybe we should keep that open, because, and the reason for this is there are several other reasons. One, we have had many discussions in this platform. You can see the recordings, they are there, on Jyotish, And there is some, Alok Sharma ji, who is one of our senior Vaidyas from Delhi and deeply involved in Jyotish. He says that there is a connection between certain houses on the Jyotish chart, on the Kundali, and some aspects of physical outcomes, particularly hemophilia he talks about. But I know hemophilia has a very deep genetic component, but it can also have a very deep epigenetic component. And the epigenetic aspect can be controlled by anything in the environment. Sound can control epigenetic. All the gunas that we have, the Vimshati gunas, everything can influence epigenetic aspects of. So unless what the comment made by my friend in Italy, Vincenzo, is we know the textbooks, we know all the research papers. Let us move it beyond this. That is the real science. The science, the real science is lying somewhere beyond the textbook, beyond the samhitas, beyond the commentaries. And when we come together, like what Karthikeyanji is saying, that only when we come together, we bring the Siddha people, we bring the modern medicine people, we come all together and say, okay, we know all the textbooks now. We know all the things that are published. Now, what is remaining here? And this is the power of Agnihotriji's question, is let us go beyond. Let us go beyond what is already there, and let us start to collect some data. I hope I've understood, Agnihotriji. I hope I've understood your comment.
Sir, we have got a reply from Mr. Rajesh's wife.
Rajesh.
She told that she has observed all the precautions, and she had an eclipse phase during her pregnancy, but still she have a say autism baby. So
the only question I have for Rajeshji, namaskar, is
hello,
whether.
sir. I am wife of Rajesh. My name is Harshita.
Namaskaram. What is your name?
My name is Harshita, sir.
Harshita, namaskar.
Namaskar.
Harshita, namaskar. We are so happy that Rajesh is here with us, and now you are also here with us. Thank you for joining us, Harshita. And you now have access to a galaxy of. I use the word galaxy because they have so many years of experience.
Yes.
From Prasadji is there, Lakshmi is there, Renukaji is there, Karthi is there. So these are all people who you can access directly and ask your questions. Please,
yes.
Harshita, please, the floor is yours. Please share us.
Yeah.
I have one question, Harshita ji. Could you see a connection between any of the vaccination aspects? This is a very controversial question here.
Actually, what I have observed is, from my experience, I have taken utmost care in my pregnancy regarding diet and everything, but there was a lack in emotional thing. I was very much stressed during pregnancy. I always think like maybe that is the cause of my autism child, because I don't have any genetic factors, even in my family and even in Rajesh's family as well. But I was very much stressed in pregnancy and as well as post-pregnancy also, when I was breastfeeding my child. And also, yeah.
Harshita ji, thank you for mentioning this, because this is the point that Lakshmi ji has raised, that
yes.
all the women are working these days and they're doing two jobs. They are working outside, then they come home and they do the work in the house. And then if there is a child there, then there are three jobs there, So could you tell us a little more about the kind of, if you don't mind sharing here, because it's an opportunity, everybody is listening here, what kind of, when you talk about these anxieties, what kind of things did you feel that could have been a trigger for this?
Actually, it says that's
we are losing your
not like things when I was pregnant.
We lost Harshita ji, we lost your signal in between.
Yeah,
could you
sorry. Yeah, I was a bit a kind of emotional person that time during my pregnancy. I'm not sure whether it is due to hormones or something, but I was taking everything into my mind. And in my pregnancy, actually, it happened more. And even in my postnatal period, it happened more. Maybe I think because of that, my child is autistic.
Excuse me, whether you are having your that pregnancy as per your consent or your choice?
Yes, sir. Yes.
Okay. Then it's all. At least that was not the sector where one can lead to any sort of anxiety or with the willingness of both the partners. It was there, but rest of the things maybe because of the
Yeah.
Right.
And also, I would like to add one more point here. After 1 year, I had to start my work. Because of the work I do, I work as a software professional. I used to work in Bangalore. So I thought like there is nobody to take care of my child. So I have left my child in parents' home. And my
Oh.
child was there till 3 years of age.
In India?
In India, yeah. We were staying in Bangalore and my child is with parents' home near to Bangalore. We used to go there once in 2 weeks. Maybe that is also one reason, but I'm not sure that. But there are so many kids actually of my friends. They are also doing the same.
I don't think that may be the point, because you see, this runs in almost so many families. My elder son also, as we were posted in remote area in those days, we left him to our parental house at the age of 2.5 years, and my wife used to come on an average of 2 months every 2 months. So in that way, it was good looked after. So if where you are keeping, not in crunch or with the nanny nannu aajkal jo maid servant chal rahe hain, if you keep in your first relation, second relations family, then there is no problem, nothing doing. Financially, emotionally, relations mein, if you maintain there, then that may also not cause any anxiety. Okay.
Okay. And one more point I have observed is I was very low in vitamin D and vitamin B12 when I was about to get pregnant. I was tested for these levels for some, I mean, it was causing severe hair fall for me. So I was suggested for vitamin D and vitamin B12. I was very low. So that also, I noted that point. I'm just remembering that before my pregnancy. But I'm not sure. I'm telling these things happened to me.
Harshita, please clarify this vitamin D point again, because I think Prasadji might want to join here. Please clarify. Could you clarify when you say?
Yeah.
Was it
my
before
vitamin
pregnancy, during pregnancy, your vitamin D levels?
That is before pregnancy, sir.
Before pregnancy, okay. Could we maybe, Harshita, please stay with us, because we might hear something from Prasadji, also from Lakshmiji. I think Lakshmiji has some thoughts in her mind, but I don't know if Prasadji or Lakshmiji, I don't know, Prasadji, would you like to just touch on that point of vitamin D deficiencies?
Sure, Madanji. I think any deficiency shows a problem with the OJS as well as the status of the dhatu. So when you have a compromised OJS and a compromised status, we call it as sambat of dhatus, that can reflect in your offspring as well. But meantime, I would not like to blame on that vitamin D aspect in Mrs. Harshita's case, because you see, as you were asking earlier about the issue of vaccination. Sometimes I have seen many parents who has kids with ASD. All the deterioration or regression started maybe 1 month or 1.5 months after getting the MMR vaccination. But at the same time, WHO has categorically denied that there is no association between MMR vaccination and the incidence of ASD. One English doctor, Dr. Andrew Wakefield, made a big publication that way, and his callous disregard, one book. And you may be knowing that he was thrown out of the medical profession itself. His registration was cancelled. His paper was revoked. And he was demoralized like anything. Similarly, we know hundreds of mothers who were under severe stress during their pregnancy with normal kids. We know many kids, many parents with all these potential risk factors facing through their pregnancy, but all with normal kids. The issue is there is a hidden relation, which again, as you were mentioning, which is beyond the level of pratyaksha. That is where we are all forced to, sometimes, of course, it is not an answer, sometimes forced to rely upon the karma, prarabdha, all these concepts. There are certain important clues, but regarding the Annavisha, which is very beautifully explained by Charaka, and also the concept of Viruddha, as again explained by Charaka beautifully, especially in Annavisha, that happens as when this Annavisha, that is the sort of amam which is circulating within the system, get attached to whichever srodhas or whichever dhatu, definitely issues will be getting popped up in that level. So if at all this reaches the level of Shukra dhatu, obviously it will be getting transferred to the next generation. Regarding Viruddhahara, the line concludes like this: Sandana doshasya. It can pass beyond the generations. So these factors are not properly observed or studied. We are making all efforts in the part of history taking, how to make all these things more systematic. But the problem is that when you have a normal child, nobody bothers. None of the parents or no parents think, why I got a normal kid. Only when there is an abnormal or a special kid, then only we start searching backward. And then, unfortunately, the poor parents blame themselves for even the silliest reasons. I have taken one extra cup of ice cream on the 5th month, so that could be the reason. I saw a snake on the courtyard on the 6th month, so that might be the reason. Like that. So there will be thousands or millions of normal kids and parents who might have gone through all these things. So I think before establishing these sort of associations, we need more data. But meantime, Andrew Wakefield's study regarding the risk of this live virus vaccine, in which he isolated vaccine virus from the CSF, if I got it right. I think that is actually, that is hidden, that is marginalized, that is thrown out of the scene, and he is demoralized as an unethical person. So I think there are many things which are in front of our eyes, which we do not want to see. There are many things which are not in front of our eyes, but we would like to bring to the center stage. So I think we need more information about all these factors. Thank you, Madanji. You are muted. You are muted, Madanji.
Thank you. Thank you. Thank you, Prasadji. Thank you for bringing out Andrew Wakefield and the MMR issue. And this is something you see a lot of young children, and you know the statistics well. So we appreciate what you are highlighting here as a very high association between MMR and 1 month following MMR, and that we need to do more research, and we need to, maybe this is where we need to do major research, because more recently we have some similar issues with the coronavirus also, that certain aspects are promoted more and certain other possibilities are promoted less. So I think there are some issues there, and I think we as a group, we need to keep repeating these messages, and it must be heard by more people, and we must be a little more cohesive and a little more working together to make these things into research projects for the future. Lakshmiji, I don't know if you wanted to add something to Harshita's comment and her observations, and we are lucky to have Harshita here with us. Would you like to add something? Because I think you have to issue of stress. So Harshita is correct in saying she's a high-flying software engineer working 18 hours a day coding or something, and then how do you How do you connect all these
First
things?
of all, I would like to congratulate Harshida, because she is ready to convey all these things in this such a platform. So actually, we have already discussed about many things, about vaccinations and everything. But as Prasad sir told, not everyone who is vaccinated is not getting that autism or such conditions. So with the cases that we have gone through all these years, the main factor that we have identified is stress of mothers that they have gone through during pregnancy. Because in Charaka itself, Ajay is saying that Dhirunam Upaklishta Sattvanam Utsanna Doshana. So definitely, basically the sattva of the child is Upaklishta, or the autism happens to a child who already has a weak or hina sattva, or whose sattva is affected even during pregnancy. So the pregnancy, the sattva sudayascha abhishnam, or the sattva develops, or the mind, or the develops from what the mother hears. So whenever the mother is stressed during the whole pregnancy, definitely there will be bad thoughts, and their talk, everything will be stressed. So that is what we are finding in the cases that is coming to our hospital. Actually, 2 days before, also in our OPD, a similar case came. Both were IT professionals, and they were having the same history like now Arshida has reported. And even after delivery, even after the child was 1 year or 6 months after she has the maternity leave, they started to rearing the child with the help of a nursing maid, and the maid had a different language. Okay, she was talking Kannada, and they were Malayalis. So the maid used to put the child in front of the TV, and after coming from job also, what the parents used to put the child in front of mobile or computer. They themselves are saying that we used to do like that, so that we can have a somewhat quiet time like that. So actually that is the problem, because the behavior development, it should start from that age. Because when the child starts to look at our eyes, and we have to appreciate our baby, how are you? So that from that stage, the behavior development should start. Otherwise, we cannot develop it at a sudden. When you go to school, you should say good morning. You should look at others, and you should behave like this. It should not be like that. Behavior development should start from the initial stage itself. So at that time, if there is no one to take care of the baby for developing that social interaction, then definitely this impaired social interaction will and the language development will be hindered. So I think that stress in pregnancy is considered the most important thing.
Lakshmi, thank you. Thank you so much for elaborating so clearly. And you also gave us an example of a case in your clinic a few days ago. This is very, very important. It seems like our future questionnaires, Prasadji already has questionnaires, but I think this must become a national protocol for us, a questionnaire linking some of these previously considered insignificant issues, stress, must now start to be. Karthiji might want to add to this.
I just want to add a point on this expressed by the mother, because I may sound a little radical now, but we have to understand that autism is, the child with autism does not suffer. It is only the parents who suffer. And the parents' health should be good. So self-blame is to be avoided at any cost. Please don't look back. And looking back and finding whether stress plays a role is a job of the statisticians, but not of the mother. So I would strongly recommend the mother to forget the past and look at the future. Because if you keep brooding over the past, whether this is wrong, that is wrong, am I the reason for my child's malady? I have, by experience, felt a telepathy between the parent and the child. The child understands you. If you are sad, the child is sad too. So please be happy, and then don't stress yourself on all these statistical points. What has happened is something which has to be reversed, and you have to be in the pink of the health. Don't spoil your health by self-blame, please.
Karthi, thank you so much. I think this is opening up some very, very important aspects of that. I could see Harish Varmaji putting a thumbs up there. He was agreeing to everything that Lakshmi was saying. And I feel, Karthi, that we are touching on some very important points which have tangible opportunity to get the tangible outcome. Number one is a call on this day. If I were to review our presentations today and the discussions today, I feel we have enough here to make a call for a national center of excellence on integrative approaches to autism. So that is number one. I think leadership is already being provided by Prasadji, by the interactions. At least something is being discussed with Cochin University Science and Technology. Lakshmiji, I think you have, in one of your earlier presentation, I recollect you have some interactions on the microbiome with RGCB. I don't know who is the contact in RGCB, who is the person in RGCB who is looking after that work?
Sir, actually, we were together in a Prasad sir.
That's right.
It was a multi-center trial. We were planning for a multi-center trial under the leadership of CADER. CADER is a organization of autism training under a retired IAS officer, Vijay Raghavan sir. So he initiated the movement, and we were actually trying for what research like Vijay Prasad sir has already told, with in collaboration with RGCB, Srijitra, and the Government Ayurveda College, Trivandrum, Kannur, and Tripunithura. It was a multi-center trial. So,
where is that study now, Lakshmi?
No, actually, we submitted a project proposal of around 7 crores, but there was no one to fund for 7 crores.
What did they?
Sometimes 75 lakhs.
Sometimes you put a project for 10 crores and they say this is too little. They don't tell you that. You should make it 200 crores, and then they sit up and say, oh, now it is looking like a project. If you ask for 7 lakhs, they don't listen to you. If you say for 5 crores, they don't listen to you. It's too small these days, you know. I think we must put together a very large initiative, because the work that is going on, from what we have discussed now, the work that is going on is very important. And as Karthi says, you know, the child doesn't feel anything, but it upsets the whole balance in that family, and the family unit is disturbed. So there is a sociological aspect that impacts, and we need to understand there is a lot of basic biology here in terms of what Agnihotriji is suggesting. There are many things, and that is already written in the Samhitas, you know. And somebody like Karthi says, we don't understand these words. You are using words we don't understand. So we need a center where all this is, you know, we talk about it every day. People are listening to it, and there is a vibrant interaction between people. And in this way, we can provide global leadership, because there are many aspects of what is written in the Samhitas that, if interpreted correctly, might open up very, very many opportunities for the future. Here in Europe, I want to give you some statistic before I try and draw this event to a close, because we are almost coming to 9:30, or well beyond 9:30. Here in Europe, there are some countries. So if we go into Eastern Europe, you know, Hungary, Poland, Czech Republic, 25% of new births have some autism spectrum issues. This is the statistic here. So it is a huge number, huge. And every country wants to know something about it, but there is no guidance. So India is already taking leadership as a WHO Center of Excellence in traditional medicine. I feel that is going to come up in Jamnagar. There was a cabinet announcement last month. And I feel our discussion today is pointing to either a department within that big institute. I think Agnihotriji is listening carefully. Either a department within the center, the planned center, because this is a global issue. And it's a global issue that requires a deep study. And it needs surveying across different parts of the world. And I feel out of today's discussion, from all that we have heard, my assessment is that we can justify a call for a whole department on this and related matters in the new WHO Center of Excellence in Jamnagar. It is one possibility. I'm not saying that should be the way it should go, but that is one possibility. The second possibility is that we have a national center for autism. Harish Vermaji is already talking about the importance of auto-inflammatory conditions, and link there. We need to understand these things, and Ayurveda, Ayush systems have so much to offer the world. If there are, the floor is open for some comments. I can see there is somebody joining us with the identifier 6E4D1142. There is no name associated with that. If you have a few comments before we draw the event to a close. And there is another with identified as Vaidya, possibly a short abbreviated to VD, and something else that I cannot see. And it has an image of the ocean and the sky on the screen. So if the floor is open for both of you, Harish ji, if you have some comments, I don't know whether you're with patients because you had a quick response, a thumbs up saying you liked what Lakshmi ji offered. If you have something to add from Toronto. Karthik ji, whether you have any last minute comments, we would like to, maybe we will do a quick round. Karthik ji, could we have a 1 minute conclusion on today, so where you think we should go? And we could go around the table and get a 1 minute conclusion from all of you. Karthik ji?
Sir, I think I have already made all my points.
Thank you.
Yeah.
If there is anything you wanted to add, we are welcome to listen to you.
I want to add that parents should maintain their health. That is their prime.
Thank you.
Yeah.
Thank you, Karthik. Prasad ji, namaskaram.
Namaste, Madanji, once again. To conclude, I would say that there should be combined efforts, and we should look forward for the model which I was proposing, because I think otherwise it is quite distressing and disappointing to do things at one end with one's own perspective, without any support, without any interaction, and struggling to come up with some points of evidence or something like that. It is really disappointing. So I am looking forward for multidisciplinary experts to work together. Of course, as you mentioned, with their independent ideas, their independent logic. But meantime, there should be some sort of a common framework for unbiased assessment and evaluation. And I am looking forward for that. That's all, Madanji.
Thank you. Thank you, Prasad ji. You made it very, very clear. You have given us so much to think about and to work on. And Agnihotriji will comment on all of this as we come to the close. Lakshmi ji, would you like some comments? Including your wish for the future?
Yeah, as Karthikeyan sir told, let's make our language more understandable, so that everyone can work together, because and I think the government of India has taken such initiatives by introducing Ayurveda into the curriculum of MBBS. So both systems can now work together so that they will understand the basics of Ayurveda also. So likewise, we can all work together, and parents, to the parents, that you have to, let's be childlike with our children and play with our children and interact with our children and make them more social human beings, who are more social. So don't make them sit in front of the gadgets. So that's all. Thank you.
Thank you,
for
Lakshmi.
the
Thank you. Your points are very practical and very, very wonderful that you have touched on some key things about when we do the next level of analysis, we see some problems there that Harshita ji gave us. Rajesh, Harshita, the floor is yours if you would like to share a few thoughts.
First of all, I need to thank thank you so much, sir. I don't know how many thanks I would say actually, because I have joined this chat without any knowledge what is going to happen. But I can proudly say that this is one of the best chats I have ever been based on autism.
Thank you.
I would like to add a suggestion, but I don't know how can we take this to know each, and because there are many parents like as who are looking for much information actually. Because being as a parent, we go to each and every person, we listen to each and every person. But I strongly feel like this is a platform like where we get a lot of information based for Ayurveda, allopathy, and everything. But I think this is not reaching to people who are really sorting some help. So do you plan something to take this to each and every people who require some help actually? So that would be a great help for all parents actually who are looking for help.
Thank you. Thank you, Rajesh. I don't know if Harshita is there with you, and could we hear some words from Harshita ji?
I'm there, sir. Yeah.
Harshita ji.
Thank you, sir, for providing me this opportunity.
Now you are the information technology person. Maybe we should look to you together with Pavanji to make a platform for these kind of interactions. Virtual platform, a global platform for autism-related discussions. And this is the way.
Sure, sir.
So
we can definitely help.
Rajesh ji has put his telephone number here. I have put my contact. I think Rajesh ji has. So Harshita ji, we will look forward to keeping this. Pavanji is listening to us. He might even facilitate this platform focused on autism spectrum disorders. So this is a possibility.
Definitely, sir. Definitely.
Pavanji is here listening to us. So, I think we are excited that except Renuji is not here from Maharashtra, but we have heard her thoughts. We have heard that difficulty with unilateral flow of engagements. I think Agnihotri is here, who has studied in BHU, and he will make sure that this message goes to BHU and other locations in Uttarakhand. At
Sir, humble request, time is 2 over.
IRES University. That's it, Pavanji. There it is. Pavanji, the floor is yours. And I think if shall I directly transfer the floor to Agnihotri to quickly conclude our...
Right,
Agnihotri, all yours. Thank you, everybody. From my side, thank you, everybody, for being with us, for staying with us, for sharing so many thoughts today. Very, very, very rich discussion. Prasadji, namaskaram. Thank you so much. Kartiye, namaskaram. Lakshmi, thank you. Namaskaram. Harishji, Harshitaji, Rajeshji, namaskaram. And Domaji also, namaskaram, Domaji, for highlighting a few points. The floor is now to Agnihotri. It's very, very late in India. So Agnihotri, leave it with you. Namaste.
Thank you, sir. Thank you, sir. Thank you. Thanks to Dr. Pavan Sharma also. And we see that it is already 9:50. We, as to save the time, two small comments on first to fulfill the suggestion of Mr. Rajesh and his wife Arshita, where the Jayesh Thakkarji already shared the link of record of today's discussion, and again this record will be available to our YouTube all the way in archives. So this is one thing. And secondly, Dr. Lakshmi in his last address searched out so many references from Charak Samhita. So Ayurveda is so deep. If it is dealt with properly, it is giving some information that when the progeny may be of some especially disabled, you can say nowadays. So though it is of academic interest, and as our Swami Kartikeya ji told that we need not to proceed with the blame game, and the parents should not be felt disturbed themselves. They should come forward. Whatever is given by God, it should be accepted, and we are supposed to manage the the rest of the life. Well, I am remembering that a few weeks ago, this type of webinar based on the hearing impairment day, that day also there was a good discussion, and on and off autism cases were also being pulled in that way. So today's discussion was very high, and with the so many questions and some hypothetical questions were also there, simply because of we are human beings, and we always see whether in our family or in other family, if any person is not having good life, we are think that how it can be improved in a way. So our all respect to all the great our revered and regardful persons, those who were present in our inaugural session, right from Dr. Jagdish Romaji, Dr. Suhas Kumar Setti ji, our Rupali Barua ji, Ved Jayesh Chakkar ji, our Dinesh Das ji, Hema Shetty ji, and our Mr. Parul Joshi ji, Madam Parul Joshi ji, again Dr. Hari Sharma ji, Professor Ramdas ji, and they all ornamented today, and our great speakers, those who are very learned, and they pulled all the possibilities, tagging all the information from allopathy, from Ayurveda, from etiology, from say precipitation of the symptomatology, and possibilities of any sort of treatment, including the previous part, a small part of the Panchkarma. So thanks to all, and it's a great and vital discussion available there in our recorded section in archives. So those who are suffering, definitely they are really great persons for whom our all the sympathy and our all the support to make them in our mainstream, and all good wishes for their kids to get their life better and better on coming years. Thank you all. Over to Pawan Sharma ji.
Please join tomorrow, sir, for holistic approach to deal with cancer. Dr.
Right.
Avdesh Pandey and Dr. Sunil Rai Arya.
Wonderful.
So please join tomorrow. Please join at 6 p.m. tomorrow.
Before we close the platform today, a special thanks to Pavanji, who always brings the best of India's Vaidyas and the talents onto our platform. Number one, Pavanji, we are grateful to you. Number two, Jayesh ji, who's working behind the scenes to hold us all together. Jayesh ji, namaskar. Vishnu Prasad ji is not here with us today, but Vishnu Prasad ji, namaskar. Thank you all once again. We missed Dr. Nerges here. Dr. Nerges, there is a request from everybody that you should join us in our next program tomorrow, and please share your thoughts tomorrow on cancer-related things. Pavanji, could we thank everybody, and we draw this event to a close. Wonderful event, a very, very important topic with extremely valuable outcomes that we will now work on to realize, especially Prasad ji's dream and what Lakshmi ji has given us, and also Karthik ji's comments. We will try and bring this all together, and we will also take this across the globe. Harish ji will find us a way to connect with Toronto. I've already sent some messages to connect with us to people in Italy on this autism spectrum aspects, and we will take this forward. So greetings to all, and namaskar from Cambridge, UK. Namaskar. Gangyosvi, namaskar. Namaskar ji, namaskar.
Namaskar, sir. Namaskar.
Thank you.
From our side, it is good night.
Good night.